Good afternoon, everybody. It's 1:30. We're going to reconvene the Monterey County Board of Supervisors. Can I get a roll call, please, Madam Clerk?
Let the record reflect all supervisors are present with the exception of Supervisor Alejo, who's absent today, an excused absence, and Supervisor Phillips, Adams, Parker are appearing via video conference, and Chair Supervisor Lopez is appearing in person.
Thank you. All right. Can we get the announcement of the interpreter as well?
Hola, mi nombre es Omar. Yo voy a ser el intérprete durante esta junta directiva.
Thank you. At this point, we're going to jump into our afternoon agenda items, starting with 21, which is a presentation regarding COVID-19. We're going to go to Nick Chulos to kick us off.
Thank you, Mr. Chair and board members. We have several items to go through this afternoon on the COVID update. The first is a group of 4 items which are all interrelated, and Dr. Moreno and Christy Michi are going to comment on those. They are state guidance regarding gatherings, school waiver update, local and state metrics, and a testing update. So, Dr. Moreno and Christy, if you're on the line, please go ahead. Thank you.
Okay. Good afternoon, Chair Lopez and supervisors. Can you see the first slide of my presentation?
We can.
Excellent. All right. So again, good afternoon. Ed Moreno, Health Officer, Director of Public Health. I'm here to provide an update. I'll begin this afternoon with updates and metrics. So as an update, the state of California has issued guidance for private gatherings, and this guidance replaces March 16th guidance and the September 12th update by the California Department of Public Health. There are 7 key features of the guidance, and this guidance is intended to provide information that households can choose to use if they choose to have small gatherings. First is that recognizing that the fewer people, the better. The state has suggested that up to 3 households could gather if they choose to. And again, the fewer the people, the better. It reduces the risk of transmission. The second is that these are outdoor gatherings, but shade structures can be used, and the shade structures would have to have at least 3 sides open, similar to some of the outdoor dining requirements. However, the state does not support any organization of multiple gatherings at one place at the same time. There's also the recommendation that people continue to stay home if they're sick. And if they develop symptoms within 48 hours, that they should notify the other participants in their group. Let's see. There's still a requirement that the participants keep 6-foot distance between households, and that there's still no sharing of items. The participants should still use face coverings as provided in the state guidance. And there's a consideration of time. How much time could groups stay together? Again, the shorter the time, the better. If people spend longer times, households spend longer times together, there's still an increasing risk of transmission. So the guidance recommends 2 hours or less. And finally, in terms of singing, groups may want to join together to sing or perform. Not perform, but to play instruments. Singing is discouraged, but if people do sing, they're encouraged to wear masks, and musical instruments are allowed. However, not wind instruments, since there is still the concern that wind instruments can transmit the virus through aerosols. This is moving on to the update about schools restarting in-person instruction. We have now the following schools that have received local and state approval to bring children back into classroom settings. Each of these schools are training their staff on the plans that they've put in place to minimize transmission or risk of transmission of COVID-19 in the school setting. Most of the schools are private schools, but we do have 2 public schools that have requested and received approval. Each of these schools can resume in-classroom instruction up to grade 6, and they can do so when they have they feel that they've adequately trained their staff and that they have acquired enough of the supplies and resources they need to implement their plans. And based on that, they will decide on a start date. Moving now to data and metrics. This is data that I've shared with you in the past. We've updated it to include the most recent week of this pandemic. And supervisors, last few weeks I mentioned that it seemed like we were almost flattening out here, but it still looks like there is an overall trend downward in the number of cases. Again, the orange part of the bar represents those individuals in Monterey County that tested positive but did not require hospitalization, and the additional green portion of each bar represents the number of individuals in that week who tested positive but required hospitalization. This is just an updated slide that shows the number of individuals that are hospitalized due to COVID. And as you can see, since beginning of September here, we've been pretty stable in terms of the number of patients in the hospital with COVID-19. As far as our ability to provide intensive care to the very sick people in Monterey County, we track the availability of ICU beds. And we did have for several weeks about 70% of the ICU beds available to us. Over the last few weeks, here represented here, supervisors, the number of beds that are available, ICU beds that are available, has decreased to about 36%. So we continue to monitor that. We continue to look at what portion of those individuals have COVID-19, and we still have. So this graph, though, is specifically demonstrating what our capacity is to take on people who need intensive care for COVID-19 or for other reasons. Moving on to specifically the metrics, I'll start with the equity metric. And again, this is we recognize that disadvantaged communities, particularly communities of color, are disproportionately impacted by COVID-19 because they have higher rates of infections, higher rates of hospitalizations and fatalities. And the state metric, which was implemented recently, really focuses on trying to help all counties to find ways and strategies to prevent certain communities who are at greater risk of COVID-19 from falling behind as the counties continue to make progress towards opening up the economy and advancing through the tier framework. And this equity metric is calculated by the state as the average test positivity rate for Monterey County's lowest quartile of census tracts as identified by the California Healthy Places Index. And that average test positivity rate for that group must also meet the blueprint threshold for tier 2 for the county as a whole to advance. This is a slide you may recall from last week, and it does depict the census tracts that are included in the lower quartile. And in the northern part of the county, we see that Pajaro, several census tracts in Pajaro area, several census tracts in Salinas, Marina, and part of Seaside and Castroville are included. And in the South County, we can see that the communities of Gonzales, Soledad, Greenfield, King City, and San Lucas are also included in those census tracts in the lower quartile. So how are we doing? This table shows on the left Monterey County's specific metrics as of October 3rd, as calculated by the state. So again, we now have 3 metrics that the state is reporting on behalf of Monterey County. The adjusted case rate now is 8.5. It still remains greater than 7, which means that based on that criteria, we would still be assigned to the purple or tier 1. The test positivity rate has dropped, and it's now last report is 4.7, and that actually falls into tier 3 or the orange tier. And then finally, the newest metric, which is the Healthy Places Index lowest quartile test positivity rate, is 7.4, and that falls under tier 2. Looking at this over time, supervisors, we've got the case rate here plotted along the blue line, and you can see that several weeks ago, the county met the criteria to allow schools to apply for a waiver, which would waive the restriction of placed on schools for not allowing in-person classroom instruction. And I just listed just a few minutes ago those schools that achieved their waiver. The second threshold here is the tier 2 case rate threshold of 7. And you can see that what we included here, what we included here is the most recent case rate that the state reported on and made public today. And so this case rate was 9.0, but it was just adjusted down by the state to 8.5. And so we do need to get below 7 to meet one of the criteria to move on to tier 2. But overall, we do see, I believe, what appears to be an ongoing decline in the case rate in Monterey County. And this, supervisors, is a graph showing the other 2 metrics. The one that we have most information on, which started earlier, is the test positivity rate, which continues along this black line, and it has met we've met the positivity rate for the countywide of below 4.9, equal or less than 4.9 by achieving a case positivity rate of 4.7 for the last rating period. The gray line depicts the last 3 rates as calculated by the state for positivity among the lowest quartile populations, communities in Monterey County. So people want to know what do we need to do to get to the next tier, which would be tier 2. And there's 2 ways. One is to get both the case rate below 7 and both of these positivity rates below 8, which they are, and do that for 2 weeks, and we could the state would consider allowing us to move to tier 2. The other way of getting there is to, regardless of this case rate, if both of these 2 positivity rates were to dip below tier 3 and they held there for a couple of weeks, the state would also consider moving us into tier 2. So there's two paths to getting to tier 2. However, both paths require that we continue to countywide in all our communities to take steps to reduce the spread of COVID-19. And again, the key strategies are maintaining physical distance, using face coverings when we leave our home, washing our hands frequently, adhering to state guidance, not just businesses and schools, but the general public as well. We definitely should all be staying home if we're ill or in contact with someone who's ill, and certainly consider testing if a person feels that they're not feeling well and have symptoms of COVID, or if they have contact with someone who's COVID, that would be certainly an indication for testing. And also adhere to isolation and quarantine guidance. And I'll talk about testing in just a moment. So regarding testing, the testing does identify individuals who may be spreading COVID-19, and it is recommended for individuals who are symptomatic or been in close contact with someone who has symptoms of COVID-19. It's also recommended that healthcare workers and first responders have more frequent testing to identify those individuals who may be asymptomatic but shedding virus, so we can remove them from sensitive situations where they might expose and infect people who are more vulnerable to COVID-19, and also protects both the healthcare workforce and first responder workforce from outbreaks. Anyone who's taking care of a person who's at high risk for hospitalization, complications, and death should also consider being tested for COVID-19. A good example of that are skilled nursing facility staff who are testing on a regular basis and looking for individuals that are working in skilled nursing facilities that might spread it to someone who's a resident of the facility. And also there's enhanced testing should anyone in the facility test positive to try to stem an outbreak. The recommendations also include individuals with frequent interactions with the public, so essential workers, and particularly essential workers who are frontline workers who engage colleagues and customers and the general public. And then finally, anyone who's concerned that they may have maybe an asymptomatic carrier should also get tested. And with the increase in the number of healthcare providers and facilities that are collecting specimens and the quicker turnaround times, this is it's much more feasible for someone to get tested and get the results more quickly. As far as the testing data for Monterey County, I just want to point out with this graph chart, is that the testing turnaround times here on the end, Supervisor last column, have gone down significantly as time goes on, and that's due to more laboratories being approved by the state of California to perform PCR tests for COVID-19, and the capacity has increased and can better match the demand for testing here in California. And then the other thing to point out is that your public health laboratory, since we've begun testing in Monterey County, your public health laboratory has processed 18% of all the tests done in Monterey County. So that's quite a few for one laboratory. The combination of all the commercial labs makes up for over half of the tests in Monterey County, and then we have a few other groups of labs that are also testing as well. So I'll move on. Let's see, we have an additional state-supported drive-through testing with the support of the National Guard. And last week, they were located in Castroville, Gonzales, Soledad, and King City, and they were successful in testing 516 individuals. We have received 326 test results so far, and 17 individuals have tested positive to date. That data will be included in the overall testing data that we're collecting. These have been free and open to individuals for 18 years or older on a first-come, first-served basis. And we have a few more coming up this week. We Hartnell College had testing, as well as Sherwood Hall. We have two groups that are in our county testing. We're also going to be later in the week, Monterey County Library at the Moreno branch and Seaside High School. Again, these are free and open to individuals who are 18 years or older on a first-come, first-served basis. And these are drive-through testing opportunities. And we also still have the OptumServe testing sites. The Greenfield County Library site will be moved to Seaside High School. And that's because we have received state approval to do so. Their last day will be this Saturday in Greenfield, and then starting next Tuesday, they will be collecting specimens at the Seaside High School. This Saturday, I believe, rather than going to 8, they're going to end a little early at 7 o'clock, so they have a little more time to break down and begin the move over to the high school. The Salinas site will not change, and they will continue to offer specimen collections Tuesday through Saturday. As a reminder, people can go online to make an appointment, but there are slots for walk-ins at these locations as well. And all this information, supervisors, for OptumServe and the new state testing, as well as providers in Monterey County, both clinics and hospitals that are collecting specimens, can be found at our website, mtyhd.org/COVID testing. And then I'm almost finished, Nick, with this presentation. I just want to touch again on influenza. We are entering influenza season, which means that we will not only have be in a COVID pandemic, we'll also be in flu season. And I think it's very important that people think about ways and are aware of ways to reduce the impact of influenza on ourselves and our communities during the COVID-19 pandemic. So the most important thing I want to share about that today, supervisors, is that we still highly recommend that people get a flu shot. I have some concern about people who have survived COVID-19 but continue to struggle because they have ongoing lung inflammation and decreased lung capacity and become short of breath very easily. And so a flu vaccine can protect these people from having influenza and the complications that could follow an infection with influenza for people who are compromised like these individuals. And people around them should also get vaccinated so they don't get sick and then pass on influenza to people who are struggling in their recovery. The flu vaccine also reduces emergency room visits and hospitalizations due to flu, which frees up our hospital beds for other people who need those beds. And then finally, we do have Monterey County supported no-cost influenza vaccination clinics. They began on Saturday, October 10th, and they'll run through Monday, November 2nd. And if people want to find out more about the flu vaccine clinics that Monterey County is supporting, they can go to mtyhd.org/FLU. And that concludes my update, Nick.
Thank you, Dr. Moreno. At this point, I'll see if there's any board members with questions. I see a hand up from Supervisor Adams.
Thank you very much. And Dr. Moreno, thank you so much for that very comprehensive report. It's wonderful. I was wondering if you could please go back to the equity slide. I want to be sure that I understand this, and I've got a question about the timing. So I don't think that's gonna, maybe this will do it. This is the one I was thinking of. Yes, thank you very much. So I believe you said that if we get down, if two of our metrics get down in the orange category and we're there for a couple of weeks, then that we might be able to move to the next category. We would go from purple to red.
That's my understanding, Supervisor.
So with the equity metrics, it's a little confusing to me. How do we move down here? I'm not clear on the way the numbers are. I see 7.6 and 7.4. Is that from where to where we have moved in the equity rating?
Okay, so this black line plots the various positivity rates countywide, and that the state has been reporting on that now for a couple of months. This gray line includes the plots of positivity rate among the lower quartile census tracts, and that's the equity index. So there are two separate rates here. This rate here on the black line is the county's overall positivity rate. This newest gray line, which just started a couple weeks ago, plots the positivity rate for the group of census tracts that make up the lower quartile in the Healthy Places Index. So next week we will have one more point rate for the positivity rate for the equity index for the lower quartile, and we will have another plot here. So we'll be tracking both of these rates, and I'm hopeful that as long as we continue to implement measures to reduce transmission, hopefully the positivity rate will slowly continue to drop, and if we're successful, particularly in our communities that are hardest hit with COVID-19 and slowing the spread, hopefully that the positivity rate in those census tracts will also drop. But this 7.4 would have to get below 4.9.
Got it.
And we'd have to keep this 4.7 countywide positivity rate below 4.9. And when when they're both below 4.9 for 2 weeks, that's when the state would consider moving us into tier 2.
So even though, so thank you, that explained it perfectly to me now. So even though with the test positivity, we've been under that now for 2 weeks, we still have to get the other one, the equity measure, or else the other measure that we're working on up here, what is this one called?
Case rate.
The case rate threshold. We have to get that down. Does it matter that, I mean, everybody, all of the measures have to be down, or 2 out of those 3 have to be down for 2 weeks? We can't go for the 2 weeks we've got and then just get it under the wire and have it be 1 week. We have to have it there for 2 weeks also.
Okay, so thank you, Supervisor, for the question. So prior to the third index, the equity index, we just had this, the case rate.
Right.
And we just had this, the positivity rate for the entire county. And at that time, for us to get down into the second tier, the red tier, this case rate would have to drop below 7, and this positivity rate would have to drop below 8, and it has. But now that there's a third index, the state has said that there is a second way for kind of like ours to go from purple to red, and that would be just looking at these 2 rates, not looking at that. We just look at these 2. The state says the other way is to get both of these indices down below 4.9, and the state will say, even though your case rate is still in purple, we'll let you go into red.
Okay. 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 Good. Thank you. Thanks very much. I appreciate it. Okay, I'm good.
Thank you, Supervisor Adams. I also see Supervisor Phillips has his hand up.
Yeah, thank you, Dr. Moreno. But with the progress that we're making, and we're talking about looking at it next week, and then for another 2 weeks, is it feasible with the progress we're making, if we make the same progress next week, that we can seek authorization from the state to move forward into red? The only reason I'm pushing so much is with the winter coming on, unless these businesses can get moved indoors, they're going to have to close up. And so time is of the essence. But you see any way that you think any door open, if we keep moving in this direction, that we can move sooner than 2 weeks, or is that the bottom line?
Supervisor, it's hard to tell what's going to happen. I think we do see a decrease in the case rate, and if the case rate were to get below 7, and we are at the positivity rate is below 8. Those are 2 criteria for red. That's one possible way. But we do have to get this 8.5 down below 7, or this 7.4 down below 4.9. And then keep it there for 2 weeks. So I'm not sure whether I can't tell whether the case rate or the positivity rate for the lower quartile are going to move more quickly than the other to meet the threshold. So I wish I could tell you, but I can't tell you. I apologize. Sorry about that.
Thank you.
All right. I've got a question for you, Dr. Moreno. I know you've talked about in the past and I forget the name of it, so that's the real question here. How many infections come out of every new infection, right? How many people does every new person infect? Can you tell us what that rate is and what it's called?
Sure. Thank you, Supervisor. Refer it to the R effective. It's an estimate of how many, when a person has COVID-19, how many other people get infected with COVID-19 on average. And our R effective is below 1 at this time. Christy Mishi, who's one of our more experienced epidemiologists, has shared that with me. So it's below 1, and which means that I think recently it got down to as low as 0.9, which means that on average, every person that we know of, and this is an estimate, of every person that gets COVID-19 in Monterey County, they will infect a little less, on average, a little bit less than one other person, and that person would come down with COVID-19. And so when the R effective is greater than 1, that means that every person has COVID-19, on average, more than one person will get COVID-19, and that's a scenario where it's spreading more quickly than we would want, and that causes the pandemic to persist longer, or we have more cases more quickly and higher rates of transmission and higher case rates. But we're down below one. We're down below one. So on average, each person with COVID-19, as a result of each person who has COVID-19, on average, less than one person is going to get COVID-19 from that person.
Thank you. We appreciate it. All right. Turn it back to Nick Chulos, and just to remind the public, we'll open it up for public comment after all the presentations.
Thank you, Mr. Chairman. We have now two updates that have to do with messaging around COVID-19. And the first is Natividad Medical Center, and I believe Hillary Fish and Dr. Gray from Natividad Medical Center are on the Zoom call and wish to give a presentation to the board on their messaging campaign.
Hi, this is Gary Gray from Natividad. Good afternoon, Chair Lopez and supervisors. Just want to introduce Hillary Fish. She's our Director of Marketing and Community Relations. You know, COVID has really caused a shift in our traditional marketing strategies. We really shifted more towards community outreach and educating our community specific to COVID. Hillary's just going to spend a few minutes sharing some of our activities and sharing a few of our PSAs. So thanks, Hillary.
Thank you, Dr. Gray. Good afternoon, everyone. Thank you so much for having us today. It's wonderful to see so many familiar faces on this call. I'm going to go ahead and start sharing my screen. The presentation that I'm giving you today is in PowerPoint, but also very visual. So we will go ahead and start that now. So as Dr. Gray mentioned, we have focused much of our resources on providing education and outreach to our community. So one of the things that we did first is we paused a lot of our, we paused many of our marketing branding efforts that we were currently doing, and we just refocused those dollars, reallocated those dollars. So we'll go over kind of the highlights of what we've done. The first being we created a round of COVID ads and public service announcements. We have presented to ag workers in the fields. We've coordinated with other hospitals, and we've also talked about patient stories and other communications regarding COVID. So this is a PSA that we did with our staff here at the hospital, encouraging folks to wear masks. I also want to note that all of the imagery and video clips that I'm presenting today is available in Spanish. We do translate 100% of our marketing to Spanish and post that on our website in a mirrored website, espanol.natividad.com. And so we'll go ahead and get started on the PSA that we produced.
At Natividad, your family's health and safety are most important to us. We know you're working hard to protect yourself and the people you love. So remember, whenever you're out in public, please wear a mask. Make sure it covers your mouth and your nose. It's still important to stay 6 feet away from others and wash your hands. When we all do these things together, we help everyone. And if you ever need us, Natividad is always here for you, your family, and our community.
We also created PSAs at the very beginning of the pandemic in Indigenous languages and Spanish and in English. One of the things that we noticed right away was that very few things in the United States were translated to Spanish, but much fewer were translated to Indigenous languages of Latin America. With the partnership that we have with Natividad Foundation's Indigenous Interpreting Plus program, we produced a series of PSAs that were presented on social media. And these talked about everything from the new shelter-in-place order to what COVID was, to the precautions that one can take to avoid getting the disease. Here is Lucia and Israel who did the presentations. When we started filming in the end of February, we actually had PRI The World come out to interview us and follow us along. I'm gonna just play a little bit of that segment for you. My hero, Marco Werman, on introducing this segment.
If you look for information about the coronavirus in the world's major languages, English, Mandarin, Hindi, Spanish, you'll find it easily. But for less spoken languages, the harder it becomes to pass on critical information. The World's Monica Campbell headed to Salinas, California, an agricultural community where interpreters are trying to break through language barriers and get out urgent information about the virus.
The goal here is to get the word out fast, and today in one particular language.
And
I'll go ahead and pause it there. It's a fairly long segment. You can find it on our website, and I'll make that available after our meeting. Another thing that we as a hospital did was we partnered with our local ag community, including Grower Shipper Association and a coalition of activists called MC-COA, as well as the other 3 hospitals in Monterey County to bring outreach education directly into the fields. Dr. Moreno mentioned earlier about the equity metric. Well, we know from our experience that disadvantaged communities and communities of color are disproportionately affected by diseases, and they have higher infection rates, hospitalizations, and death for COVID-19 in particular. So back in the spring, I believe we started in April, we started doing outreach. So far, our combined efforts have led to us reaching more than 5,000 agricultural workers in the fields. This was headed up by our family medicine residency program, as well as our RNs and faculty staff. I'm going to play a little clip for you here from KSBW.
Industry as a whole is trying to do its part to stop the spread, and that includes a partnership with the Grower Shipper Association and Monterey County's 4 hospitals to bring nurses and doctors into the fields and into the plants to educate workers on COVID-19.
This is one of our family medicine residents.
This outdoor classroom at Ocean Vista in Castroville is one of many happening across the Central Coast.
We've had over 3,000 workers trained.
Nurses and doctors bringing COVID-19 education to the workers. Big Ag acknowledging that this is a high-risk population.
And one of the great things too is that Natividad Foundation also provided interpreters as needed. So if we needed to have an indigenous language interpreter, we had them available. Natividad Foundation also worked with the Community Fund of Monterey County, with the COVID-19 Relief Fund of the Community Foundation for Monterey County to provide 5,000 reusable masks. One of the hurdles that the agricultural workers faced in the beginning was a shortage of PPE. So this happened fairly early on back in, I believe, June. We have also given some marketing dollars to doing some influencer spots. So we have partnered with Showbiz and Kadon and Velia on La Preciosa to do some Facebook posts regarding the COVID hotline that Natividad staffs. So that's a bilingual hotline. It's available.
Hey, what's up, guys? It's Showbiz. Do you have any questions about COVID-19? Do you think you need to get tested? First things first, call the Natividad coronavirus hotline. If you're experiencing symptoms like cough or fever, virtual screenings are available.
Velia, so we wanted to reach the Spanish language population. She's very popular on La Preciosa.
Natividad tiene ahora una línea telefónica que le pueden contestar cualquier pregunta, Ellos pueden atender.
We also did a hotline radio ad. I'll play a little bit of that for you.
Do you have questions about coronavirus or think you need to get tested? For timely, accurate information about COVID-19, call the Natividad Coronavirus Hotline at 831-772-7365.
So another thing that we have done that's pretty unprecedented for the hospital systems in Monterey County is partner with each other. So back in February, Monterey County Health Department, along with Me Memorial, CHOMP, and Salinas Valley Memorial Healthcare System all partnered to create a joint information center. So the public information officers for each of the hospitals sit on those that joint information center, or JIC. And together we have created a series of public service announcements. We've also really communicated to each other about different policies and things along those lines that we want to get out to the public in a unified way. So for instance, we all came out with the same visitation policy at the same time, so that there wasn't any confusion, because we knew that that would be something that was going to be really hard for the public to kind of take in. So later in the summer, we produced a PSA regarding safety around COVID, and specifically mask wearing. I'll play that now.
The following is a message from the leaders of Monterey County's hospitals.
There are 4 simple things that we can all do to prevent the spread of COVID-19. First, wear a mask. Wash your hands.
Keep 6 feet apart.
Avoid large gatherings.
Thank you for doing your part to keep yourself, your family,
and Monterey County healthy and safe.
Brought to you by the hospitals of Monterey County.
And we also did some public service announcements. We also did some public service announcements that were in digital and in print, and we did another public service announcement that also went on
COVID-19 is rising in
English and
Monterey
Spanish
County
stations.
at an alarming rate. It's serious and it affects everyone. But there's one simple thing we can all do to make a difference. Wear a mask. Wearing a mask can save your life, and your friend's life, and your neighbor's life. It might even save a stranger's life. Wear a mask for you. Wear a mask for all of us. Brought to you by the hospitals of Monterey County.
So combined, we invested about $75,000 into that campaign, and it ran for about 45 days. We are replacing it at the end of this week with this campaign. Oh, excuse me, I forgot about the press conference. Oh, there's Supervisor Lopez. So Supervisor Lopez was our MC for our press conference that we had with all 4 hospitals. So each of the CEOs for the hospitals spoke at that socially distanced press conference to talk to the media about different COVID developments, as well as their vision for everyone taking safety precautions such as mask wearing. And this is the next PSA that we're doing, which comes out later this week. And as Dr. Moreno mentioned, we are encouraging everyone to get their flu shot this year. It's probably the most important year to get a flu shot, particularly if you want to avoid getting quarantined if you get sick. So here we go.
Do I have the flu or COVID-19?
And you'll be the first
That
to
is
see
a
this.
question some of us will ask at the first sign of a cough or fever. Flu season is here now, and COVID-19 remains a serious threat. You can stay healthy by taking these simple steps. Get your flu shot. Wear a mask. Wash your hands. Stay 6 feet away from others. Taking care of your health is important. To find out where you can get a flu shot or for information about COVID-19, call 211. Brought to you by the hospitals of Monterey County.
And Karen Smith actually suggested that we include 211. I know that they've been a wonderful resource for Monterey County. Excuse me. Here are some of the print ads in English and in Spanish. Those will be going in a variety of different print publications, as well as digital. And then finally, we have, I'm just going to round out with some of the other things that we've been doing here at Natividad. We recently sent out a newsletter to about 50,000 households in Salinas. And the newsletter was bilingual, Spanish and English. It included some tips about staying healthy, how and why to wear a mask, and also a really important thing that I think that we overlook sometimes, a page of community resources. So I worked with several activists and community resources to get accurate information about food programs and childcare and unemployment insurance and things along those lines. So just a nice resource for people. And we're also coming out with a COVID-19 flu and newsletter. That one is going to focus on getting a flu shot and how to stay in or go out and stay healthy, things along those lines. And internally, we did a patient welcome video. So for patients that are new to Natividad.
Welcome, and thank you for trusting Natividad with your care. I'm Dr. Melissa Nothnagel, Chief of the Family Medicine Service at Natividad. During this uncertain time, we remain dedicated to providing you with high quality care to help you recover as quickly as possible.
So as you can see, we did that in English and in Spanish, and that plays on televisions throughout the hospital. So it's talking about folks staying safe during COVID, what kind of precautions Natividad is taking. There was a lot of hesitation, I think, in the beginning to seek out healthcare. We definitely saw a dip in emergency room usage at the beginning. Nationally, we're seeing a huge dip in preventative screenings. I was just reading a statistic that's 51%, there's about a 51% drop of breast cancer diagnoses in the United States at this time. So that's alarming to us as healthcare professionals, just because we want to make sure that people are getting the help and healthcare that they need. We also talked about survivor stories. This is just one of the Facebook posts that we did. We also interviewed this gentleman. His name is Anastasio Cruz. He was 59, had no pre-existing conditions. He was at Natividad for 3 months and almost died. And he and his family were just so taken aback that they pulled through, and he did several interviews with local and national radio and television and print. So you can see here, it's a lot of shares and a lot of views. People really love this story. And as you all know, Natividad participated in some drive-through testing. We had pop-up sites in Castroville, Marina, Monterey, King City, and Chular. And thank you all for your support with that. That was a really great program. And that concludes my presentation today.
Thank you, Hillary. Let me see if we have any hands up from board members. I see Supervisor Phillips has his hand up. Supervisor.
Well, thank you, Hillary. I got to say, thank you for the presentation. We had the experience of working with you here when you came for testing here, so that was good. My question is, how'd you ever pick Supervisor Lopez to be your MC? I mean, how'd that? Who made that?
I don't know. I think we just lucked out on that one.
You picked the prettiest face around, huh? So, all right.
No comment. With that, I'm going to take us over to Supervisor Mary Adams.
Thank you so much, Hillary. Terrific presentation. Thank you. Really enjoyed it very much. And had 2 questions. First, a comment. I'm so thankful to see that you're using 211 in the as far as the contact number, because we've been hearing from people that it's so confusing because there are so many different telephone numbers that are being put out. And with 211, it's very simple to remember, and I know that people appreciate that. So thank you for using that. And then secondly, I just wanted to know how the work that Natividad is doing coordinates with our outreach program that the board has funded through the CARES program. And I'm not sure who would respond to that, but I just wanted to know how that is, how that's going.
Maybe Dr. Gray might be better to respond to that one.
Yeah, I think, there certainly is an interest in, coordinating messages and so I think there has been some consultation among all the hospitals and the health department and the various folks that are interested in rolling out information to ensure that messaging is appropriately aligned. With regard to funding of the Natividad's efforts and the collaboration with the other hospitals has been funded through our Natividad's internal marketing budget.
Right. It was more the coordination of the messaging rather than the funding.
Okay.
Yeah.
Mr. Chulos.
So, and a lot of the messaging that, a lot of the messaging that we've done from all 4 of the hospitals has been in coordination with the Monterey County Health Department. So I don't know if that's helpful.
Thank you.
Mr. Chairman, just to kind of add to that a little bit in answer to Supervisor Adams' question, which raises a very good point. As you can tell from the presentation, which was terrific, a certain amount of the messaging is around hospital operations and that sort of thing. I think there's also a component of the messaging that's broader public awareness of COVID-19, and we would appreciate the opportunity to coordinate with Natividad and the TMD company. We would look for some opportunities to engage on that, and be glad to talk with Dr. Gray further about how we might do that.
Thank you. I think that would be a great idea.
I saw Supervisor Parker had her hand up. It went up and down. Just want to make sure I didn't miss you there, Supervisor.
Thank you, Mr. Chair. I was just going to say that particularly the announcements in Indigenous languages could be really helpful for our team to be able to get out into the community. So I was going to ask the same thing of, are we cross-pollinating as appropriate? I know TMD has created a Dropbox where people can use the graphics and the materials that have been developed, and I would hope that Natividad can take advantage of that, but also put some of the resources that they've developed onto that Dropbox as well, so that the good work that's gone into this can be shared as broadly as possible. Thanks.
That's a good idea, and I do have access to that Dropbox, so thank you.
And Hillary, I know I said this the last time we presented. I think just the one piece missing for me looking at the presentation is that Univision contract, just because they are the largest TV outreach to the Latino population in Monterey County. And so I think we can look at messaging to make sure we touch that, knowing that, as I shared in my house, that's the only thing on from about 2 o'clock to 6 o'clock in the evening with my mother-in-law and my wife using that as a primary source of news. I think that, I think they've got the vast majority of the market in Monterey County by far, so we want to make sure we partner with them somehow to make sure the word gets out. I know we're doing that through the TMD side, but through the Natividad side, I think we still have some opportunities to reach out there.
Yeah, and they have been receptive with some of our public relations efforts, so they have been helping us tell some stories and get information out there through public relations.
Perfect. All right, with that, we'll go ahead and turn it back to Mr. Chulos.
Thank you, Mr. Chairman. And our final component this afternoon is a very brief update from Nick Pasculi of TMD regarding the messaging that we've been doing on the COVID front for on behalf of the county.
Thank you, board, and thank you, Mr. Chulos and staff. And Hillary, great presentation. It was nice to see that. So just so you're aware, our focus has been since September 25th is on flu shots, getting tested, and then discouraging gatherings. And so that's been our primary focus on our public service announcements since the end of September, and will continue to be up through the election cycle. At Supervisor Alejo's request, we also are doing a social media campaign with regard to voting and encouraging people not to be afraid to vote. Not instructions on how to vote or anything like that, but just that voting is safe. And we're using the Monterey County Elections URL as the resource for information for voting specific information. We are also involved in a social media campaign to discourage illegal dumping, as Supervisor Phillips has mentioned before, and also what I call COVID trash, all those masks and rubber gloves and all the other things we see on the streets. And we're hitting that very, very hard on social media. And then the other thing we are promoting on social media is the idea of testing. We are also, Supervisor Adams, using the 211 as a resource for folks to find out information about testing, and the feedback has been very, very good. I would like to add that it is a very good thing that Karen Smith is on our steering committee, that we meet every Friday. So I think in some respects, there's been some organic coordination between what we're doing with the CARES funding and what Natividad is doing. So I think it's complementary, and it seems to be working very well. The things we have upcoming that I think are worth noting is we are working on a set of PSAs. Of course, everything's in English and Spanish with regard to having a COVID-safe holiday. And we are using the new guidelines that Dr. Moreno has presented to you all today with regard to gatherings. And we're incorporating those talking points into our public service announcements. We're also going to be focusing on, after the election, with mental health and mental health resources. Obviously, we all know that COVID has taken a toll on our community, has taken a toll on us in various different ways. And so we felt it was a good idea to spark a conversation about that and to let our citizens know what resources were available here in Monterey County. And then finally, we are going to be working with Chris Donnelly on developing some messaging with regard to resources that are available for small businesses. Small businesses are suffering just like individuals are suffering, and so it's important to let the small businesses in our county know what resources are available through workforce development and that great department that we have here in the county of Monterey. I don't want to be redundant with anything that Hillary has said, but at this point, those are the things that we're focused on. And Supervisor Lopez, we do have a very, very good presence on Univision. In fact, they've been very generous with us, and almost more than half of the spots that we're placing, I think it's closer to like 65%, are PSAs, no charge spots. And so they've been very generous with us. So we're maximizing that relationship to the best we can.
Thank you. Any questions from board members on this presentation? Okay. And with that, what we'll do is open it up to the public for any comments or questions on all of these COVID updates. The first hand I see up is Cesar Lara. Cesar, we're going to go ahead and give you 2 minutes to share public comment with this board. You should now have the ability to unmute yourself.
Good afternoon, members of the Board of Supervisors, Cesar Lara. And first of all, I wanted to appreciate all the reports that the staff had, and hopefully my comments aren't taken in a negative way, but in regards to the equity matrix or the equity targeted COVID outreach, I'm just wondering if in a future meeting we could have a presentation on what is being done separately for those targeted populations, because I want to agree with Supervisor Phillips and others that we need to get those numbers better so we could reopen, and I think the state took a step forward by looking at those equity issues in targeted communities, and I wanted to see what the county in coordination with the cities and others are doing in those populations, in those geographical areas above and beyond what the great work you guys are already doing. So thank you very much.
Thank you, Mr. Lara. I don't see any other hands up and nobody coming forward in room, so we'll go ahead and close public comment, bring it back to the board. Any final thoughts from supervisors?
Oh, wait, yes.
Yeah.
Thank you. Thank you. I do have to go back a step or two to Dr. Moreno to ask a question again about the equity matrix, if that would be acceptable. And I wanted to ask this. I remembered reading that there is we need to submit a plan to the state, and that there is a possibility of receiving grant funds. And I just wanted to know what our plan is for creating, or what our plan is for creating the plan, and if there's an opportunity for public input, and if so, how are we going to design a plan, and how can we allow for public input?
So Ed Moreno here, Health Officer, Director of Public Health. So the plan, we're working on the plan right now, and one of the things that we're looking at is actually taking some of the strategies that were identified and shared in the disparity report on COVID-19 that was presented to your board, and taking some of those strategies and moving them into the report. So in many ways, this report that's going back to the state, much of the work is in preparing the response has already been done, in that been putting together a report that was brought to you. So that's for the report. The work goes on though, and we're going to continue to continue the successful strategies and still try to work on some additional strategies with the funding that we're receiving. Some of those responses Supervisor, that we compiled are the product of some of our engagement with the public through the variety of task forces and advocacy groups that have been meeting, including county staff. And so I'd like to think that we do actually have some public input into that. But moving forward, it is very important that we get public participation and private sector participation in these ongoing efforts to try to reduce the positivity rate in that census tract. So we will definitely do our best to get as much input as possible so we have the most effective strategies implemented.
So is the technical assistance team that you mentioned, is that the same as the group that we're working with now? The, what is it called? The support group that we've been working with? Is that the same, or is that something different?
The Unified Support Team
Unified
visited
support,
us.
right.
Right. So that's unique to Monterey County and mostly Central California Central Valley counties that are predominantly ag-based. So that's one effort that's going on. But some of the people that are on that team are also involved with our statewide response. All counties involved, being involved in responding to, or most counties being involved, responding to the state in a report that we're all using the same template. And most counties, the medium and larger counties, are going to have to reply. And we'll be working closely with Mr. McKee in preparing this to make sure that it really does reflect all the work that's been done and things that we want to implement and enhance on moving forward.
So if people want to have their opportunity to provide input into the plan or the other work of the technical assistance team, what is the avenue that they need to follow in order to be able to do that? Should they come through us to you? Should they go directly to the CAO's office, or should they come through public health?
Yes. So we could work with the CAO's office on that. The state didn't give us much time to work on it. It's actually due, I think, Thursday. So,
yikes.
Yeah, so very short turnaround.
Are you sure you should be in this meeting now?
However, we think that this is going to be a monthly report, and so we can work with the CAO's office to figure out how we can start thinking long term and continuing our ongoing process of engaging different sectors of the public to provide feedback and input and suggestions.
Okay, great. So the trusted community partners that we all know and work with will be best served by going to Charles to get.
I think that would be up to Charles. I'm saying we will. I think maybe Charles can answer.
Silence, Mr. McKee?
Yeah, I'll step in. Thank you.
Yeah.
Probably not the best idea to get good information as far as how to address a pandemic. I think we need to include our health experts in that. Obviously, there's some other strategies that we want to incorporate in that we're going to reach out to the community. What I would suggest is that we come back to the Board of Supervisors have a presentation from the health department on updates to the plan and what the plan is, and kind of as a augmentation to the disparate impact report that we've done, and get some input from the public at that point. I think that would be helpful, as well as we might have some individual meetings outside of the board meeting, but that might be the first step, is to have something at the board meeting, have Dr. Moreno and Christy Michi, our epidemiologist, present on the plan.
Okay. So I will tell our trusted community partners to, skip the initial plan and wait for the updates to have input.
Well, if they want to send something to us now, that's fine. I'm not sure who our trusted community partners are. I know there's a lot of them out there that have a lot of important information, and I think there's a lot of good ideas out there. And they can certainly send it to me and to Christy and Dr. Moreno, and we can look at how that might be inserted into the current plan. I know there are some strictures of the way that the state is looking at the plan at this point. So we just have to stay within those kind of
that format, so to speak.
Yeah.
Exactly. Okay. All right. Okay.
But if somebody if somebody wants to send something to us, we certainly can take a look at it. And I think, as Dr. Moreno was saying, that there will be updates and updated updates to the plan itself from what I understand going forward. So I don't think this is a static situation.
All right. Thank you very much for everything.
Yeah,
I'm going to go to Supervisor Parker next.
Thank you, Mr. Chair. Yeah, just sort of along those lines, I was going to say, since the public commenter asked about what the strategies might be that we're using in these disadvantaged communities, it probably would be good to plan to bring some of those strategies forward, and it sounds like we'll be checking how effective they are and updating the plan and so on. So just figuring out what the schedule is for that to make sure that it's, you know, a regular feature on some sort of, you know, calendar. And I think between the CAO and the health department, they can, you know, figure out what that schedule is. But it does seem there's a fair amount of interest, definitely in getting the transmission rates and the positivity rates, case rates down, but also, you know, keeping them down and making sure that we're using every possible ally and channel that we can to do that, to keep people safe and healthy. So thanks.
Supervisor Phillips?
Yeah, Supervisor Adams and I were some people, and they were pointing out and looking at this and looking at some things that had been done in Fresno that they thought there was some things that maybe we could look at. And when I got back to the office and had my office, of course, I couldn't do it, but they pulled up their website and everything. We looked at some, there may be some things, some suggestions there that maybe would be helpful for us to even expand better what we're doing. So I just pass that along.
Thank you. We'll go back to Dr. Moreno.
Yes, thank you, Chair. So I also want to point out that most of this report that's going back to the state is tied to the equity index and also the how we're using our epidemiology and lab capacity funding. So we would appreciate any suggestions that the public might have. But in the end, we do need to stick to the template that the state has provided with regards to the equity index and how we're spending our epidemiology and lab capacity grant funding from the state to bring down the case rate and address the inequities. So thank you.
All right. Thank you, everybody. With that, we're going to go ahead and head into our next item, which is 21.A. It's also related. That'll be a presentation from Chris Donnelly of the Workforce Investment Board on the board's proposal to create a small business relief program. Mr. Donnelly.
Good afternoon, Chair Lopez and Supervisor Chris Donnelly, Director of the Workforce Development Board. Last week, the County Board of Supervisors directed staff to come back and look at developing a small business grant relief program and looking at the funding what has been available from the District Attorney's Office. And that's approximately about $468,000. So I have a presentation that I would like to share with the board and for your input and questions when we go through it. So I'll be sharing my screen now. Try to open it up. Okay. There, can you see that now? Yes, okay. So what we're looking at is that the Workforce Development Board could look at providing a small business relief out of the CARES Act funding with approximately $468,000. And this is the funding that was available from the District Attorney's Office. This would be going to businesses that have been directly affected by COVID-19. And those are to be in forms of grants, not loans. Next slide is that the Workforce Development Board currently has a small business grant development program that we have in place right now. So we look at expanding our existing grant program. Right now we have approximately 109 applications that we've received. We've been funding 60 businesses right now with approximately about $80,000. We have $137,000 what has been set aside for small business grants using our rapid response layoff aversion funds. We do have the connections to business in the community as part of the Workforce Development Board We outreach to businesses. We provide them additional services in regards to additional training grants that they could be able to use for upskilling employees or looking at additional resources of hiring people. So we're very well equipped to be able to work with businesses in Monterey County. Next is that we look at the eligibility and criteria. We want to be able to determine eligibility and guidelines that we'll set forward. Part of this is that we have an existing application that we want to be able to update our application outreach materials. We're looking at having an application that'll be web-based. Currently, our application we have is a PDF downloadable where people could be able to download the application and then apply for it. We want to look at this application where you can actually go onto our website, fill out the application. It might take 5 to 10 minutes to be able to fill out the application. They'll come to us, we'll be able to review it, approve it, and then we're able to go ahead and be able to approve their funding and to ensure that they can be able to expend the funding in timely manners. What we're going to do is look at outreach into the community with other cities, county agencies, with Monterey County Business Council, SBDC. We're looking at trying to outreach to the businesses in South County, Latino businesses as well. And so we want to be able to complete outreach to the whole county. Part of it is that we would like to do informational webinars. And those webinars would be information on how to be able to apply for the grants, what we need to do in terms of FAQs, who would be eligible for these grants, the funding levels that we'd have as well. So we look at the week of October 26th that we'd hold a number of webinars for those individuals that we'd like to apply. We're looking at as an application window of approximately 2 weeks. We know that we have a short timeline to be able to get the funding out to small businesses for them to get their information back to us and be able to get that money out. So if we looked at a third week, if we aren't seeing a lot of businesses applying for the grant, we could look at extending the third week, or we haven't exhausted all of our funding. So what we're looking at is when a business applies for the grant, we could be able to immediately look at applying and approving that grant. So we could be able to keep updated in terms of how much money is available through the grant application. And part of the Workforce Board's responsibility would be reviewing the applications, communicating with applicants, and providing guidance and support to each of those businesses that are looking at it. What we do is that we'll be able to issue checks every 2 weeks and process those reimbursements as well. Well, excuse me. So the timeline that we're looking at is approval by the County Board of Supervisors today. Next week, we'll be able to begin our outreach to business and community and other partners. As I mentioned, the week of 10/26, we'll look at informal webinars. Now we could provide information to those businesses about applying for the grants. The week of November 2nd, we'll begin accepting applications through the website. We look at, if we go to a third week, we look at that would be the last week to submit an application for the small business grants. And then the week of 12/14, that'll be the last week that those businesses could be able to submit receipts for reimbursements. And then the week of 12/28, we'll look at pros and closeout final reports to the budget office in terms of the expenditures that we have and how much money has been encumbered and paid out. Next slide. So we're looking at the different levels of funding that could be available to the businesses. We looked at various levels. $5,000, we could look at applying for 83 grants. At $10,000, approximately 42, or at $15,000, we could look at 26 to 28 grants. Or we could look at that the grant could be based on a need or a fixed amount. So we're going to be looking at direction from the board on which way we'd like us to proceed. That if you'd like us to have an open end of $15,000 and based on those needs, then we could be able to move forward with that. The Workforce Board is 100% federally funded. We don't receive funding from the county. So what we need to look at is being able to charge somewhat of administrative cost to cover our costs for outreach, updating our website, social media, and then also the payment process and staff times to be able to go through and do the monitoring and reporting. We looked at up to 10%, but I don't know if that'll be the amount. It could be 5% based on the expenditures and the time it'll take for us to be able to put forward the grant application. Next slide. We're looking at eligibility, and this is what we would like to receive also guidance from the board. We want to open it only up to businesses operating in Monterey County. We feel that a business of 75 or less employees would be in the target zone of small businesses that we're looking at. We want to make sure that they're certified in the application process, that they were directly affected by COVID-19. One of the questions that we'll ask the board for clarification is that, if they've already receiving PPP funds or with our small grants, would that exclude them from that? We know a lot of businesses that receive the PPP funds are still in dire needs and still need additional resources for them to keep their businesses open, especially going forward to the winter months. Allowable costs that we're looking at would be employee salaries, rents and utilities, equipment for COVID-19 exposure mitigation. And we also would look at going back to being retroactive to March 18th, 2020 through December 11th, 2020 as a period of funding. I know that some businesses have already received some loans, but they could look at submitting those expenses for reimbursement as well. We would look at verification by the Workforce Board, reviewing all the receipts. We'd look at doing a random monitoring of 10% of the grantees to make sure that the expenditures were valid and that they were using the funds that were intended as part of the PPP or the small grants in CARES Act. We'll also be doing a random sampling for auditing as well. So additional directions from the board that we'd like to receive back from you is, do we want to look at the funding being restricted to only the unincorporated areas of the county or open it county-wide? Is there a specific industry that you'd like us to focus in on that? Hospitality, food and accommodations, wine industries? And is there a funding threshold that you'd like to look at as $15,000 the level, or is there a different level what you'd like to see that we'd be able to put out for funding? And what is the number of businesses, number of employees within a business? Is 75 too high? Or we'd like to go down to 50, what we currently have with our small business grant. That concludes my presentation, and additional comments and questions from the board. We'll look at.
Thank you, Mr. Donnelly. Any questions from board members at this point? Supervisor Parker.
You're on mute, Supervisor Parker.
Thank you. Some people prefer it that way, but thank you for this presentation and how quickly you pulled a model together. So I had a question about eligible expenses. I wondered if there were some sort of tax payment that the business owed. Would they be able to use this for that?
I'm not sure. We'd probably have to get clarification from county council on that, determine if that is allowable cost under the CARES Act. Yeah, we know that when we do our application, we want to make sure that each of the businesses are in good standing and that they have a business license within Monterey County or within their local jurisdictions that they reside their business in. So.
Mm-hmm. Yeah, thank you. And I was also wondering, so I know we're focused on getting the money spent in time, but my impression from the action we took, I think it was last week, was that we may be in a position to have some more flexibility in terms of time and how we allocate the money. And maybe Mr. Woods or someone can speak to that. It could be that people need the money and they can apply and, submit their reimbursements and, all of that, so that the money might be expended by December. But I thought I had the impression that we had directed that some actions be taken, which might give us some more flexibility. So I guess that may not be a question for you, but for someone else, about whether we are strictly speaking tied to those timelines to expend the
Mr.
money.
Woods or Mr. Vega would be the best person to answer those questions for you.
Supervisor Parker, let me see if I can field that. I think we did create some flexibility with some of these uses for CARES Act by trying to shift some monies around, so we're using other monies other than CARES Act monies if needed, so that we can go past December 31st if there was a need at that point. I don't know whether the specific dollars that we're talking about here, which were originally allocated to the district attorney's office, whether they would fit into the bucket that we're talking about. And what I would ask is that we come back with an answer to that at a future meeting. Start the program as directed by the board today, and then if we can create some flexibility, and the board would like us to, we can come back at another meeting to see if that's available.
That makes sense. Thank you.
Supervisor Phillips.
Thank you, Mr. Chair. A question. Do you think the first question you asked was whether it should be restricted to the unincorporated areas in the countywide? Are any cities having first question is, are any cities have a similar program? I seem to remember Seaside having a business loan or grant program, but so that's the first question. I guess the second one is would we have enough interest in the unincorporated area if we didn't include the cities where a lot of the restaurants and other businesses are?
So just to answer your second question, some of the research we did, there's about 19,000 businesses in Monterey County that we know of based on the Duns and Bradstreet's records we're receiving. The majority of the businesses that are in Monterey County are outside of the unincorporated areas. So I think it would be doing well that we look at the grant countywide. But again, it's on the direction of the board of which direction you'd like us to go. I know that within the Monterey, that they did have the grant that was funded by the community foundations, that they had money with that, and also with the city of Monterey relief in the city of Seaside. I know that there was some grant release, but I don't know the full extent of the funding and how much money was available to each of those businesses.
Right. Yeah. And just the last questions that you asked, that was one. The other one, for me, I'd like to see us maybe focus on the restaurant, hospitality, and tasting rooms. I think those are the industries, frankly, for want of a better word, have been screwed over by this process more than any other businesses have. I think I would like to keep it at for the smaller businesses that are struggling. Maybe I'd put maybe instead of 75-50, but that's just my thought. And administrative fees, I think we shouldn't go over 5%. And if it's more than that, we ought to just eat it. And that ought to be our county's contribution to it. But that's just my thought.
Thank you.
Thank you. I see Supervisor Adams has her hand up.
Yes, thank you very much. Chris, thank you for this very comprehensive presentation. I know when we talked about it at the Workforce Development Board meeting recently, I was really delighted to see that we're here today. And thank you also for the numbers. I was going to ask how many businesses there are located throughout the unincorporated area, but it sounds like throughout the whole county there are about 19,000. So one of my concerns is that I think we would really be challenged to get all of the funds out if we only were doing this program in the unincorporated area. So I support Supervisor Phillips's thought that we need to include the cities as well. So I feel very good about that. One of the other questions, though, that I'm wondering about when we talked about not having any PPE or they could not have received any other funding. I want to talk about that and get input from my colleagues as well, because there's a part of me that feels that, just if a small, and I think also these need to be locally owned businesses, not any kind of an outside, chain or something. They need to be locally owned. But if they were able to get some sort of payroll, PPE loan or some other kind of help that they needed, and were able to pull that together and get it done, I don't know that we should necessarily stop them from being able to to come back and get this funding as well. It feels like it's a little bit different from a different pot, so to speak, but nonetheless, if these places have just been barely holding on, and I can tell you from some of the research that we did locally, there were companies, businesses on the Monterey Peninsula specifically, who had just barely been making it through September when the PPE ran out, and they weren't, PPP ran out and they weren't sure what they were going to do. And the same for those that had help through October. So I think it might behoove us to really think twice about saying, you know, no double dipping. I think that really is something that we should look at separately. And then whether it's 75 or fewer or 50 or fewer employees, do we have any stats on how many businesses we have that are at 75 employees compared to those that are at 50 employees? Again, I don't want to narrow the pot so small that we won't be able to use the funding that we have here.
Thank you, Supervisor. So we are working with one of our vendors, EconoView, that is actually finding data for us in regards to by sector, the number of businesses, what are in the unincorporated areas and incorporated areas with employees 50 to 100 and then 1 to 50. So we'll have that information by Friday on the number of businesses within Monterey County, but it'll be based on sectors. So it could be the hospitality, tourism, food accommodations, ag as well in those areas that we could be able to, and retail. So we'll have that information by Friday on the number of businesses with that threshold.
Good, thank you so much for that. And again, I'll corroborate with my colleague Supervisor Phillips and say that I too would like to see us focus on the general hospitality industry. It seems like they've had a terribly difficult hit, and I think it would have a big impact on a lot of employees to be able to continue working. So again, thank you so much, Chris. A job well done.
Thank you.
Mr. Chulos?
Yeah, Mr. Chairman, I would just like to ask Mr. Donnelly clarification just to make sure I'm correct about this. Mr. Donnelly, these are grants or loans that you're talking
These will be grants.
Okay, thank you.
Perfect, thank you. Supervisor Adams, saw your hand go up again?
Nope, sorry.
Okay. Yeah, I just wanted that clarification and wanted to remind folks, I know it seems like it was years ago, but we did set up our revolving loan fund because I had some folks reach out and ask, is this a loan or is this a grant? That we set up in April through Cal Coastal. I know it seems like a lifetime ago now with COVID and everything we've gone through, but those were up to $25,000 loans. I believe the rate on those was 75% of prime. So just wanted to throw that out there. And before we continue our conversation, I wanted to give Eric Cushman an opportunity to share some comments. I see him with his hand up there on the attendee side. So Mr. Cushman, we're going to go ahead and give you the ability to unmute yourself and share your comments with us.
Thank you. Good afternoon, Mr. Chairman, members of the board, Mr. McKee. I'm talking to you in my capacity as chair of the Monterey County Workforce Development Board, a job that I've been in, or a volunteer position that I've been in for about a dozen years now. And I'm calling in to urge you to support having the Workforce Development Board administer this pool of grant money. I think as they've demonstrated, they have the structure in place in this brief history with their layoff aversion funds. Those were very small grants that I think they could quickly deploy and get the results that we're looking for. As you know, it's kind of overstating the obvious, but the need is great. It's just it couldn't. I'm very close to the business community. It couldn't be more dramatic. This money will dramatically help local employers and will give the Workforce Development Board an opportunity to do as Governor Newsom often says, to meet the moment. I'd like to say that I will pledge my full and personal assistance to try and make sure that this program is carried out with the urgency that I think the timing needs. The schedule that Chris put together obviously is very compressed, and I think it's also very doable. You know, if the grants are $10,000 each, that's 42 grants. There's, I don't think it's going to be very difficult to qualify that number of applicants, and gonna hope that we can get the money out sooner. I mean, soon. The details of trying to get the word out, I think, will be pretty critical. I know some people who are in the newspaper business, so I hope that they can lend some help there. I'd also suggest that we work hard on getting the word out to North and South County businesses and the SUBA, the Hispanic. There is no longer a Hispanic Chamber of Commerce, but beyond just the Salinas Valley and the Monterey Peninsula Chambers, I think there's a lot of businesses that could benefit greatly from the program. As to the specifics, I just wrote down some notes after seeing the slideshow, and I think I would probably, since you've invited me, I'm going to presume that you're interested in my opinion, so I'm going to share it freely. You're free to obviously discount it. I would recommend keeping it at the 75 employee threshold, just because I think there are a number of restaurants and wineries that probably have more than 50 employees, and you don't necessarily want to eliminate them from the pool. I would recommend making it available to businesses throughout the county and not just in the unincorporated areas. In essence, saying that the cities should be, businesses located in cities should be eligible as well. The programs that the city of Seaside, in addition to the city of Marina, put a small program together in the city of Monterey, those were all very small. This is it's not PPP money, but this is considerably more per grant than any of those programs. I would also, like Supervisor Adams said, I would recommend against disqualifying businesses who have received previous CARES money. I think that they still may have great need, and it may be the difference between staying open through the winter and not. So I think that there are qualitative opportunities for the staff of the Workforce Development Board to prioritize businesses, and I think that we shouldn't. I would recommend against limiting it. I would recommend against excluding people who've received previous CARES money. I would very much suggest tying in a note that says that the businesses must be headquartered in Monterey County. And if you're, the last comment that Supervisor Phillips made about limiting it to, and Supervisor Adams, limiting it to restaurants and tasting rooms and general hospitality, I would ask you to include the arts presenters and the arts community in that group, because while many restaurants have set up shop on the street or in the parking areas, the symphony and the chamber orchestra and the California Roots Festival and the Jazz Festival and all, they are, you want to talk about who's been hardest hit. They were the first to close, and they were absolutely going to be the last to open. So it could be vital for them. Those are, that's the totality of my comments. As a quick aside, thank you for inviting me to talk to you all today. I would make sure that the supervisors and all the other folks listening and watching today's meeting are aware that the Workforce Development Board also has 2 other grants that are money from the Department of Labor that are related to the urgency of COVID. And one is to put essentially approximately 20 people who, they have to meet certain eligibility requirements, but 20 people to work at food banks and homeless shelters, and 50 people to put to work mitigating the impact of the fire at Toro Park. Those jobs are going to be approximately 32 hours a week, approximately $17.50 an hour. And as I said, they are only for qualified applicants. But if you could help get the word out that those are going to be coming down the pike as well, it'd be appreciated. That concludes my comments. Thank you.
Thank you, Mr. Cushman. With that, I'm going to go ahead and open general public comment on this item, see if we have any public who wish to share their thoughts. I see nobody in room coming up to the mic, and I see no hands up via the Zoom. So I'll go ahead and close public comment and bring it back to the board. Having heard all that discussion, for me, remembering back to what we did for Cal Coastal in that revolving loan fund as we set that back up, perhaps, Mr. Donnelly, you could put up your presentation again for us, and with your 4 questions that you kind of needed some direction on to help us kind of figure out the response here. But for me, I just want to make sure that we also reach out to the King City Chamber, Soledad Chamber, who are in South County as well, as we go to move this forward. So on the restricted portion, I think, and I don't know where my colleagues are, but I'd love to see sort of what we did with Cal Coastal, where we set aside 50% of the dollars for the first 30 days for unincorporated, and the other 50 are open. If they don't all get used in the unincorporated, open it up to everybody after that. So it just kind of gives a little priority to those in the unincorporated area, just for half the dollars. Again, it's open to everybody, but half the dollars are set aside for those businesses in the unincorporated, just for the first 30 days to give them an extra shot. In terms of the question of the number, I think specific industries, I think it should be open to everybody. Funding thresholds, I like the 10K, and the business number of employees, I like 50 and below. That's just sort of where I am after hearing all the input. With obviously the big question for me is whether or not to prioritize those who got the PPP funding, and I'd love to hear my colleagues' thoughts on that. But those are sort of my thoughts and where I am now. I'll go ahead and open it up, and I see Supervisor Adams has her hand up first. Supervisor Adams.
Thank you so much, Chair Lopez. Actually, I was prepared to make a motion, but it sounds as if you'd like to have more conversation at the board level.
Correct. I mean, just love to hear where everybody's at. I know we got pieces of it, but there's 4 questions there with sort of one more that was added in conversation, which was the question about the PPP funding. Okay,
I'll hold back. Thank you.
Supervisor Parker?
Thank you, Mr. Chair. Yeah, I would say I like the idea of setting aside a portion and maybe prioritizing unincorporated areas. And in terms of the question of timing, if we are going to go with a fairly short application period, of 2 to 3 weeks, I would say maybe everybody can apply and the screeners take the unincorporated county ones first, in a sense. Anyway, some sort of mechanism to do what you're talking about within the timeframes in case that, we need to keep it tight. But I agree that there's probably a need countywide. But I do think, for us, we're the unincorporated county, so I would really like to see us make sure that if there are needs there, that we focus on those first. Specific industries, I don't claim to know the variety of small businesses that there might be in Monterey County, so I would hate to arbitrarily exclude some folks who might need this. So I think we keep it open to any small businesses that are locally owned, locally headquartered. Funding threshold, I would say up to 15,000 based on need. I don't know that, anyway, I just think, someone might just need 4,500, who knows? And the number of employees, I could go either way. I don't have strong feelings, but I do think 50 and below, that's already kind of a category that we work with. And that makes sense to me. Also, the questions have received money already. I especially think that if they've received money from our Workforce Development Board, they should still qualify for this, because this is funding different things than that earlier set of money was, in terms of the equipment to cope with COVID and so on. The PPP, I'm not sure. I sort of feel like probably, this thing has gone on longer than I think any of us expected. So it could very well be that a business might have gotten money from PPP and need some more, but maybe there's a filtering process that the screeners could use to prioritize those who maybe haven't received if someone's applying to use this money for salaries, for instance, if they already received some, maybe they're the second tier. I don't know if that makes sense, but just a thought to try to make sure that we're using our money, as sensibly as possible. And again, I just appreciate that there is such a structure in place and really knowledgeable people able to craft something like this and implement it, this quickly. Thinking about 10% administrative costs, I mean, less than 10% would be great, but I think up to 10% is reasonable. Particularly, as Mr. Donnelly said, he doesn't have money except from state and federal sources, so he doesn't have a pot he can dip into. So I would say allowing there to be some administrative allocation makes sense. Thanks.
Can I put you on the spot, Supervisor Parker, and ask you one more quick question? Mr. Cushman did throw up the idea of asking that the business be headquartered in Monterey County. You touched all the points, wondering what you thought about that one.
I did include that, yes. Locally owned or headquartered, or I meant to say that, so.
Okay, perfect. Supervisor Phillips?
Yes, I agree with that point. I like your idea of at least giving a little head start to make sure that the industries in the unincorporated area don't get run over. So I give them a head start, but not guaranteed. And I was looking at special industries because they've been the one banging on Supervisor Adams and my door, but it was brought up. There are some other ones that you're not thinking of. So I agree without restricting it. I think we ought to limit it to 10K, maximum 10K. I would limit it to 50 or under. And as on the PPE issue, I don't think it ought to exclude them, but obviously that ought to be a factor in evaluating if you got two industries or two businesses that are similarly situated. I think some priority ought to be given to the one who hasn't got any grants or money from PEE. So those are my thoughts. But I agree, we ought to keep it with local businesses. So.
Thank you. I'm going to ask Mr. Donnelly if he could give us a little insight on those issues. The question of being able to prioritize those who have not received PPP funding, and also the ability to set aside or prioritize a portion of the funding early on for unincorporated businesses. Do you have a mechanism within your agency that you're comfortable with that might be able to help us make those things a reality?
We could probably look at in the application process that those questions could be asked when they apply. And then we could also look in terms of looking where the business is, if it's in the unincorporated area in Monterey or countywide. So we could be able to look at that as well, yes. One of the questions I do want to bring up is that I asked if we look at retroactive going back to the March 18th date as well, when shelter in place started.
Could you just talk a little bit about why we might want to do that and why we might not? We don't live and breathe these things, so it's probably a good question, but I'm not sure how to think about it.
Okay, I think part of it is that there are some businesses that might still need some cash. They've already outlaid cash in the first couple of months to be able to purchase PPE equipment or things what they need for their operation, tables, chairs, heat lamps, tents, and so forth. And it might be difficult for somebody who can now just look forward for the next month or so to be able to look at expending those funds. So the question is going back that there's already expended funds, we could be able to reimburse them. That's additional money in their pockets to go forward with those costs.
I'm comfortable going back to March.
I'm comfortable going back to March.
I'm good with that as well.
I'm good.
I see Mr. Gerard might have a question. I want to kick him the ball here.
Thank you very much, Honorable Chair, members of the board. I get a little concerned about decisions that are made kind of on an arbitrary or subjective basis. And I was going to ask Mr. Donnelly if he's contemplating a scoring system so that there would be an objective standard based on some kind of point system that decisions would be made based upon, rather than some type of subjective review of applications.
We could look at that and put a process in place that we could go through a scoring mechanism in terms of some of the questions I brought up. Unincorporated area has a first priority, the threshold of employees, if it's like an industry specific and so forth, or just opening it wide, we could be able to look at those as criteria for the selection of these businesses.
Thank you very much.
Okay. So with that, I think we've had a great discussion. I want to see if there's any other members who have questions or if somebody's ready to make a motion.
I'm going to try to make a motion.
Okay.
Well, let's see. So I better stop for a second. I want to go back to the numbers of employees. And I'm really hopeful that we could agree on 75. And that would be full-time equivalents. Because as I look throughout my own unincorporated area, and I would expect the others would be doing the same thing, some of the restaurants, they are restaurants, and they're going to have more than 75 people, or more than 50 people, I should say. So I'm really hoping that we can go to the higher number, to the 75. So I'm hoping I can throw that in as the maximum number of employees. So I would like to go ahead and make the motion that, number one, we approve the program through the Workforce Development Board, and that I'll start from the whole thing, that we approve expenditures for businesses located in the unincorporated area and in the incorporated cities. We allow staff to work out the other eligibility details based on the prioritizations that we set forward, ensuring that we're going to be able to reach the broadest population possible. The businesses must be locally owned, headquartered here, and operated locally. And the prioritizations then will be as follows. That, and the last one on that one though, is that previous CARES funding is okay, and that it would be retroactive to the beginning of shelter in place. The priorities that would need to be looked at, on the business side, the priorities would be hospitality, arts, and others. The priorities for the types of, that's the priorities for the types of businesses. The numbers of employees would be a maximum of 75. The grants could be from $5 to $15,000. 10% overhead or 10% administrative fee is fine. I think it should be tracked. And I believe those were the primary things that we wanted to see covered. And my hope is that I could get a second on that motion.
I may have trouble voting for that. I still think 50. I could be pushed, but I think 50. I'd leave it open to what industries we're talking about. But I think 50 and at least some kind of priority system initially for the unincorporated, and I think I would limit it to 10,000 unless we can't get rid of it. So
I agree. I'm sort of in the boat with Supervisor Phillips on this and trying to get it to more businesses by limiting it to 10.
If that's a substitute motion, I'll second it.
Okay. Supervisor Phillips, is that a substitute?
Yeah, I was just bumbling around, but yeah, I guess it is.
Yeah, I'm happy to, what I'm conscious of is that what a tight timeline we've got here. And if you want to prioritize, have another one of the prioritizations be look at the unincorporated area first and then the incorporated area, I'm good with that. I don't think that there should be any, let's hold the money until X happens, because this is going to be so tight. And plus they have to develop all of the things that have to go along in setting up this additional program. So I'm just conscious of the administrative work that needs to be done before they can even start moving on the actual program itself. And I just don't want us to put so many stumbling blocks in the way that'll make it difficult. But with the prioritizations, as we had said, you know, that's fine. If you want to keep it as 10,000 as the top, that's good. But I really hope that you'll reconsider on the numbers of employees. You know, I could be off base on this, and maybe we'll hear back from Chris when they do a little bit more in-depth look at the numbers of businesses that we have that hit the 75 mark or that are between 50 and 75. I'd be fine with them, you know, sort of making the decision on their own. But I'm just worried that we're going to be cutting off people if we come up with too few numbers of employees. And I don't even know from which I speak, other than just thinking about a couple of the restaurants that I have down in the Big Sur area that my hope would apply for this. And just thinking that they may well have more than 50 people who work for them.
Thank you. So Supervisor Phillips, I want to quickly try to restate your motion just to make sure we're clear. So we are opening this up to all areas of the county, but with a prioritization for unincorporated. And Mr. Donnelly will find a way to give that points or weight in their system. We're going to open it up to all industries. The funding threshold is 10,000. The business number of employees is 50 in your proposal. We are looking at prioritizing those who have not received PPP funding, and they must be headquartered in Monterey County. Would that be a correct summation of your motion?
Yes, sir, and a lot more succinct. Thank you.
Thank you. And
no prioritization for businesses?
No, it was
for types of business?
Oh,
no,
it's open. Yes, that's what that's what I meant to second.
Seconded. Okay, perfect. So we have a motion and a second. Can we go ahead and get a roll call vote, please?
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
God, I'm in such a pickle here because I disagree with the internal part, but the external part of just doing the program is so critical and important that I'm going to have to say yes, although I'm disappointed, I should say, in the way that the prioritizations have come down. So yes, aye.
And Chair Supervisor Lopez.
Aye. The motion carries. Thank you so much.
Mr. Chair?
Yes.
Mr. Chair, maybe I can hear the angst in Supervisor Adams, and I want maybe if you all don't mind, maybe as the applications come in, or we need to look at what is the timing for expending the money, right? So we may have some flexibility there, and I guess as Mr. Donnelly gets information about those businesses that are between 50 and 100 employees, if he sees some reason that we may not be able to expend the money that we have, or that, you know, an important segment is being left out, maybe he can bring that information back, you know, in the future.
I'll agree with that. And as chair, if he brings it to us, we'll make sure to prioritize getting that in front of the board.
Good. Yeah, good idea.
That's important. That sounds good. Thank you, Jane. Thank you, Supervisor Parker.
Thank you.
You happy now, Supervisor?
A little less unhappy.
All right.
All right. Thank you, guys, for that birthday compromise. Now we're going to head into 22, which is to receive and consider an informational presentation from LAFCO. That'll be Kate McKenna and Mr. Mike McMurray making a presentation on a recent study done by LAFCO. So at this point, we're going to turn over the floor to Kate and Mr. McMurray.
All right. Good afternoon, Chair Lopez and members of the board. I am Kate McKenna, Executive Officer of the Local Agency Formation Commission. It's a real pleasure to speak with you today. We appreciate your time. Also with me this afternoon is Mike McMurray. Mike is a retired fire chief from Scotts Valley and also a consultant to LAFCO. Today we are presenting highlights from a recent study prepared by LAFCO staff and consultants. This study was adopted by our commission this past summer. Information in the study provides a high-level overview of fire protection and emergency management services in the unincorporated areas of Monterey County. We based the study on interviews and information that we obtained from special districts, county agencies and departments, and 2 volunteer fire companies. Our focus in the study was on the day-to-day operations of special districts that provide essential services. We did not focus on their individual capacity to respond to major wildfire events, but of course, if fire agencies are challenged with their day-to-day resources, they become even more strained during a major fire incident. Our study recognizes the roles and accomplishments of hardworking and effective local governments and volunteers. It also provides information about structural funding problems that result in some stark differences in service delivery capabilities. Our traditional LAFCO tools, such as annexations and consolidations, have been used over the years to help patch up some of the historical problems, but we do find that fresh approaches are needed to sustain and improve the delivery of fire protection services and EMS services in Monterey County. With that in mind, the LAFCO study suggests some ideas for consideration by the state of California, by the County of Monterey, and by our local agencies. We appreciate this opportunity to present the ideas and hope that some of them will lead to collaboration and action. It is in the spirit of collaboration that we present this educational information today. We also offer to assist and facilitate the efforts of local governments to work toward positive actions to increase our wildfire preparedness and protect our communities. With that, I will introduce Chief McMurray, and he will be presenting some slides that we're going to be sharing on your screen in a moment here. And for your information, copies of the LAFCO study and the slides that you'll be seeing are posted on the LAFCO website. So thank you, and if you could just please bear with us for a moment. Mike?
Thank you, Kate. First thing I'd like to thank Kate and the team here at LAFCO. This report couldn't have been done without them. At the onset, Jonathan Brinkman and Darren McBain have been 2 stellar cooperators who have collected a lot of the data and information that you find in the report. Next slide, please. Are you seeing the slide presentation on your end?
Yes.
Thank you. For today's purposes, we'll be going over the purpose and the background of the report. We'll talk a little bit about the county's role in fire protection in Monterey County. We'll talk a little bit about the study agencies and the facts around them. We'll talk a little bit about the key findings from the report, options for consideration, other service models, and a few parting comments. Primary purpose of this report was to meet LAFCO's statutory obligation to do a municipal service review of the agencies every 5 years. In addition, we wanted to highlight some of the great work by the people in the agencies that provide fire protection and EMS services in the county, including some of the supporting agencies. We also wanted to call attention to issues that the agencies are facing and offer some ideas for improvement. Next slide, please. Organization of fire protection is accomplished in a number of different ways throughout the country and in California. There's various reasons for the current status in Monterey County, which has evolved over many decades. As you know, Monterey County is very diverse in population, has diverse geography and climate. There is not a one-size-fits-all approach that can be applied for fire protection in the county. A variety of agencies provide fire protection, including federal, state, and local agencies. And this report is focused on the local fire protection in unincorporated areas. There is no mandate in state law. The county is not required to provide fire protection services and currently does not in the unincorporated areas. While the county is not a direct service provider of fire protection, county EMS service provides, the county does provide EMS services through a contract with private service provider in addition to working with the hospitals. The county also operates the 911 communication center and has a direct regulatory responsibility for land use and development in the unincorporated area, which also has an effect on defensible space and wildland fuel reduction. The study agencies we looked at were 10 fire protection districts, each with an independent board of directors, one community service district that provides fire protection, the Monterey Regional Airport District, and 2 volunteer fire companies on the coast, along with CSA 74, which is the county service area that is countywide for the Emergency Medical Services Agency. You can see on the map the location of all of the fire companies, fire districts throughout Monterey County. Overall, in the unincorporated area, the population is 107,645. Just over 15,000 calls for service in the year, just under 1,500 square miles served. And we did take a look at a number of different metrics that we used to look at the revenue and financial status of each of the agencies. I would call to your attention in the report table ES2, which is in the executive summary on page 13, that gives a breakdown of the metrics as we looked at them. The main ones that we looked at for the finances of the agencies were the percentage of property tax received by the fire districts, the revenue per capita, which is a common metric that LAPCO uses for determining financial stability. We looked at assessed valuation, overall of the properties within the district. We looked at the number of parcels in the district, and we looked at the calls per staff, which can be an indicator of how busy the district is compared to the number of staff that they have. About 2% of the unincorporated area population in the county is what we would consider in an unprotected area. That term is a common term used when there is no local fire jurisdiction within the area for those residents. Those unprotected areas are a combination of privately owned land, state properties, and federally owned land. The key findings in this study was the first question we asked was, were they able to sustain services for the next 5 years when they looked at their own projections? They all answered that yes, they were able to sustain services for at least 5 years, but may have to change or adjust service levels, meaning reducing staffing on fire equipment, closing fire stations, either temporarily or permanently, and that there was a combination of other cost savings measures that the boards were considering in order to keep the doors open. We also noted that the revenue limitations are not keeping up with the costs of operations. and there's a wide variety of financial resources in the agencies, which has resulted from decades of varying financial capabilities, which has led to variations in service levels. Some of them have first response paramedics, for instance, on the emergency medical side. Others do not. Some have career staffed equipment, while others are all volunteer. And facility equipment replacement are often based more on the financial condition of the district, more so than on the needs. Previous consolidations and annexations have been effective, as Kate reported, but there are limited further opportunities because of the financial resources. In every interview that we talked to the officials from the districts, concerns were expressed that further consolidation would likely cost subsidies and drain existing resources from agencies to the detriment of one agency that has to subsidize another. At this point, the districts are not currently seeking any LAFCO actions for annexations or consolidations. And related to finance, the cost of converting from a career operation or from a volunteer operation to a career operation, in other words, the difficulty in recruiting and retaining qualified volunteers, that cost gap is significant. We worked up a model budget of about $250,000 for a single station volunteer operation to a 3-person staffed engine company for that same station. And it goes from $250,000 for volunteers to about $3.5 million for a career operation for a single fire station. One of the impacts that we've seen, not just in Monterey County, but in the fire service in California in general, is that there's been a significant reduction of the number of volunteer firefighters. The demographic has changed in many communities where it's no longer the community members that take off from their primary job and go out and volunteer as firefighters. There are a number of reasons for the reduction in volunteers. But for the most case, the volunteers are now more interns into the fire service looking for careers in the fire service. Some districts have had success taking advantage of that by recruiting candidates from MPC fire science program. We've had wildfires that have had significant impact on the county, obviously recently and even prior to us starting on the report. With the current fire season still active, we're seeing that fire insurance has been a significant problem and will likely have greater impacts. In fact, it's had such a great impact that the insurance commissioner has ordered a public hearing to investigate the number of fire insurance policies in the wildland urban intermix areas that are being canceled, or the prices are so high that people can't afford them anymore, which are required to satisfy their mortgages in most cases. In addition, we noticed that we heard a lot of feedback on vegetation management and clearance for defensible space purposes. We also heard that tourism has been a big impact to the Big Sur coast. The bulk of their call volume comes from the tourist industry. So it's not locals necessarily that are causing the calls, but in that area there was concern over the tourism and the amount of impact that that's created, as well as they have concerns for the long term for the 2 fire companies along the Big Sur coast about the sustainability of their operations for the long term. Districts with small populations, primarily in the Salinas Valley, the 3 districts, Gonzales, Mission Soledad, and Greenfield, all are fire districts that are in the outskirts of those individual cities that they surround. and they each have a contract with the city to provide services back out to the rural areas. Since the city now is a great portion of the area that used to be the district, the population base for those areas has diminished. So there is a possibility that they will have difficulty recruiting board members in some of those areas because of the lack of population to draw from to get board members. CSA 74 has been providing funding for training and EMS agencies operation for the last number of years and has been successful for that purpose. We did interview the 911 center staff and commend them for their terrific work. They are dealing with ongoing staff shortages and increased equipment costs, which has been an ongoing problem for the dispatch industry. Within the report, as Kate mentioned, we looked at some options for consideration. Again, not things that are mandated, but we asked for input from the agencies on how perhaps we can improve the system. For today's presentation, we focused on the county level or county-wide sorts of options, which you would find in the executive summary on page 10. And we also, because the 911 center is a county department, we also looked at some of those concerns. For the county-wide or county level options for consideration, one option that came up a number of times was the notion of coming up with options for funding fire services countywide. We looked at a number of funding that are legally authorized within the limits now. One concept is to consider an overall funding instrument that would help level the financial standings of the district countywide. Consideration could be given to participation in a broader organizational discussion and or methods of improving the system overall. We all know that the fires these days are crossing boundaries, and so the automatic aid and things that could be done to break down those barriers would be a positive. We also noted that we heard a lot about the fuel management defensible space is critical to the reduction of threat of wildland intermix fire problems with the structures. While there has been a lot done by the county and allied agencies, there's still a lot more to do. CSA 74 provides great resources to the EMS agency and EMS training. Critical to the EMS mission is cooperation and collaboration between the fire agencies and the EMS agency to provide a solid outcome-based fire and EMS response system. EMS agency already has a solid plan in place to pursue an outcome-based system, but there's still quite a bit of work to do. As mentioned earlier, 2% of the unincorporated area doesn't have a local fire protection agency, which is primarily in the remote and rural areas of the county. The county's general plan says that the development is required that any development that would occur within that area would be required to annex into a fire district as a condition of development, or in cases where annexation is not feasible, a deed restriction would be placed on the property stating that the development is outside of a local fire jurisdiction. Since the county is the authority having jurisdiction for land use, clearly it's imperative that projects in those wildland urban intermix areas especially are required to have adequate fire protection systems and services, and that coordination between fire agencies and county RMA is crucial to provide safe development within the county's scope of its planning policies. One funding source that we know that the county has is payment in lieu of taxes, or PILT funds as they're affectionately known. These funds are basically federal funds that are used to compensate local agencies for services that are provided within those federal jurisdictions. The PILT funds, after we looked into it, are limited to local general government agency negotiations, which means that fire districts as a single service agency are not able to negotiate those funds on their own behalf. However, if the county was willing, they could negotiate on behalf of the districts and fire companies to seek some of the federal payment in lieu of taxes funding. As I mentioned, we did take a further look at some of the communication issues that the Emergency Communications Department and their terrific staff are facing. One of the issues is that we noted that they're 12 positions short at the time of our interview. That could have changed since then. It was a while back that that interview was done. Nonetheless, it's an ongoing issue in the industry to find people that want to deal with the stressful job with complex technology, irregular work schedules, and those issues obviously take a toll and have created that staff shortage. One issue that we noted that is a positive but yet to be completed is the connection between the dispatch computer system or computer-aided dispatch at the 911 center with the CAL FIRE dispatch center. This is an important connection so that the real-time information gets from one center to the other immediately without having to call on the telephone to transfer or transmit information. What we found over in other areas where this has been implemented is it reduces mistakes for people communicating the information across a telephone line, and it gets it there immediately. We understand that that connection has yet to be completed, but are optimistic that the county has already approved it and should be forthcoming. We also received reports that the radio infrastructure has been spotty in some areas of the county, and as a result, sometimes missed communications on the radio, which is potentially a safety problem. Some years ago, the FCC implemented digital radio systems, and the ultimate effect on public radio infrastructure has been that it's reduced coverage overall in most counties, especially in counties like this one, where you have mountain ranges in between that get in the way of the radio signals. An ongoing strategy for upgrading that equipment will be important between the communications department and the information technology folks. We also heard that there are at times interoperable radio communication frustrations between field units and primarily the fire units and the responding ambulances. We think that it would be a good idea to make those systems a little more robust and emphasize some of the protocols and training. The county has a very robust geographic information system, and what we heard though from the fire agencies is due to the cost, they don't really use it too much. And that's unfortunate because it could help them in terms of response routing as well as planning for service levels. We also took a look at some of the other delivery models around the state by other various counties. The first one we took a look at was in Orange County with the Joint Powers Authority. There are 24 cities in that JPA, along with Orange County, which is a contract county, meaning that the Orange County Fire Authority is also responsible for all of the wildland responsibility in Orange County. So in other words, there's no CAL FIRE presence directly in Orange County. San Luis Obispo County is a county department. CAL FIRE is the contractor with that county department, but it's a county department within county government the fire chief's reports to the CAO, and it's governed by the Board of Supervisors. In Santa Cruz County, two county service areas, 4 and 48, protect the unincorporated areas with a CAL FIRE contract again, and those areas are the areas outside of the cities and special districts. Independent Fire Protection District is Fresno County. They have a separately selected board of directors that governs the fire district in Fresno County, and it's a fairly large operation in Fresno County. San Bernardino County is a dependent fire protection district. It's a fire protection district organized with the Board of Supervisors that sits as the Board of Directors for the fire protection district. So the point is that there are various models that if the county were interested in taking a step further into fire protection, that the county could consider. In conclusion, the fire and EMS services and the service levels and the funding levels vary widely depending on the level of funding in Monterey County. All the study agencies were very cooperative, engaged, and working hard to provide their services, and they all reported the ability to sustain services for at least 5 years, although some reported that they will probably have to make service level adjustments to balance the budget. The county plays an important role in managing a countywide ambulance contract, as well as the EMS oversight, providing emergency 911 dispatch, and in exercising its land use authority, including in the high-risk fire hazard areas, as well as being a cooperator in the vegetation management front. And changes in the fire severity, public expectations, lack of volunteer availability or volunteer reductions, lack of funding, certainly are straining the fire protection systems throughout California, but here in Monterey County in particular. While the county has not historically been engaged in providing fire protection directly, county government certainly has had the ability to provide resources and leadership in some areas to help improve the system, and is a critical cooperator to help with providing fire protection throughout the county. So thank you for this opportunity to present the study, and that concludes my report.
Thank you very much. At this point, I'm going to see if there's any questions from board members before we open it up to the public. I see Supervisor Parker has her hand up.
Thank you, Mr. Chair. Thank you so much for this presentation and all the good work. I hope it was therapeutic for the fire agencies to be able to talk through these issues. And I'm really glad that LAFCO has brought forward these considerations, recommendations that are maybe beyond the scope of a municipal services review, but definitely grow up out of it. So I think it's really, really important. And I've been concerned for a while about the way that fire districts, fire protection services are funded, and I appreciate that you're focusing on the county level options, and that we might look at a countywide strategy, but I'm also feeling like it may be a larger issue. So I guess one question is, are you aware of any real substantive discussions at the state level about how to more adequately and equitably fund fire protection? And I guess one of the things that I've heard fire districts actually raise is that the way the funding now comes in, they are incentivized to support essentially sprawl development, which is against what LAFCO is all about, because of the way that the funding mechanisms are set up. So I guess I'm particularly intrigued with what funding, what new, different, better funding streams might be available that don't push us into developing in a sprawling kind of way, particularly because of the fact that then we get into the interface areas where it's high risk for fire. It just becomes more important than ever to do infill and to not have our fire services being funded in a way that actually makes doing their job harder. So long-winded question, but hopefully you have something wise to say.
I wish I had the silver bullet for fire protection district funding. I don't. The primary funding source is property tax, as it stands. But that's true for districts that were formed before Prop 13 happened in 1978. So you have one district and two fire companies. The one district, Kachawa, was formed in 1993 after Prop 13 came along, so they received no property tax at all. So their only alternative is for voter-approved benefit assessment or voter-approved property-based sorts of taxes. That's really what the law allows. Now that said, the state has the ability to change any of that. For instance, there are two propositions on the ballot, regardless of what your political bent is on the two propositions. One of them is Prop 15, which basically increases the amount of property tax on commercial or corporate business. And as a result, that raises the property tax base overall for all agencies that would receive property tax. The second one is Prop 19, which is a fairly convoluted, I would say, measure that has a lot of fingers in the pie, so to speak. But one of the things that it does create a fund that is funded by some increase of property tax that would be available for fire districts in rural areas, yet to be determined on how it would be allocated at the state level. So there are things out there, and I think that there's been enough pressure now because the issue is known throughout the state, but there's still a long ways to go. I do think it's going to take a combination of state and local measures or some sort of push at those levels in order to provide better funding.
Thank you. And I guess what I'm trying to discover is whether there's any kind of thoughtful consideration. I mean, some of the propositions seem kind of reactive and sort of piecemeal. So I'm not convinced we make our best decisions that way. So, but from what you're saying, I don't get the sense that there's a set of folks who are actually sitting down arm wrestling about how best to move a set of reforms forward.
I would agree with you. And having been the president of the Fire Districts Association some years ago, what I will tell you is that fire districts are mostly folks from rural areas who are, doing the best they can with what they've got in those areas. And my point is that they're not necessarily the ones in Sacramento that are the shakers and movers and a real high profile. So we never really have had the traction in Sacramento. And if you even look at what happens more recently, where Governor Newsom has allocated funding at the state level to fire protection, it's not going to fire districts, it's going to CAL FIRE as the state's fire organization. And no disrespect to CAL FIRE, because they need the funding too. They have their own issues to deal with, but the fire districts generally at the statewide level have taken a back seat, let's just say.
Mm-hmm. Thank you. Yeah, definitely some good thinking needs, and then some advocacy needs to happen. Then another question, you talked about the staffing issues at the 911 center, and it sounds as though maybe, I think from what you said, that staffing shortages are a problem kind of not just in Monterey County. Is there any discussion about ways to help the recruitment and retention for those positions to be more successful? I mean, those are just such critical functions that they perform. And it just makes me so nervous, and it has the whole time I've been in office, thinking about the fact that some of these folks are putting in so much overtime. I don't know how people would even do a regular schedule, but working extra hours, it makes me so nervous because it doesn't sound healthy, doesn't sound sustainable. But what do you know about that arena?
Well, what I know is that you have a very competent emergency communications director. She's terrific, but it is truly a national problem. And I know there have been a lot of discussions and there have been a lot of strategies, and some have had more success than others. But at the end of the day, it's a tough job, as you pointed out, and I think some of it is a little bit of the nature of the beast, unfortunately, but I do have hope that good people are going to take those jobs and do well.
Thank you.
Okay, see no other supervisor hands up at this point. I want to open it up to the public. I know we've got some folks here who want to share some thoughts with us, so we'll go with in the room first. And after this first comment, we'll go to the Zoom. I just want to remind folks participating via Zoom to please use the raise hand function, which is at the bottom of your screen. If you're participating via landline, *9 will raise your hand and let us know that you wish to be recognized. At this point, we'll go with in the room.
Great, thank you. Thank you, Chair Lopez and fellow supervisors and county staff. Again, I'd like to thank LAFCO staff, Kate, and Chief McMurray for doing a great comprehensive study of fire protection in Monterey County. I believe the comments that are made, I echo. One, I think we've been dealing with in Monterey County the last few years is the increased property insurance issue. And I think now, since we burned another 4 million acres in California, twice the prior record, 92 homes, I think 35 lives lost. If you think we had issues before, it's going to continue to compound. So it's a direct correlation to financing to the unincorporated area fire protection. If you look at a document that was provided with the finances of these fire districts, if you look at Kashawa, Midcoast, and Big Sur, for example, they receive 0 property taxes. So if you're an insurance carrier, right, and you look at those entities and you look at kind of what fire protection is being provided there, they're basically relying on donations from the community, and the county is fortunate enough to provide them some Prop 172 funding. I think Midcoast and Kashawa get $56,000 in sales tax. Big Sur gets about $89,000. We know now with sales tax going down, so their funding is going to be reduced even further with our Prop 172 reduction. So again, I think to Supervisor Parker's point, and we know the supervisors have advocated for us, districts that surround cities. When we talk about future growth going to cities, we don't share in those revenue sources. So when they annex our land, right, they're taking our property tax values with them, but then we see the demand for services as cities grow and they travel through the unincorporated area. So we would continue to ask that the supervisors, when they're negotiating those annexations from districts into cities, that we're looked out for. Thank you.
Thank you, Chief. I'm going to go to Steve Snodgrass next. Steve, I see your hand up. We're going to give you the ability to unmute yourself and share a 2-minute public comment with this board.
Good afternoon, Honorable Chair and supervisors. The LAFCO study is very comprehensive, and I applaud the good work done by the LAFCO staff and Chief McMurray. The salient issue for me that comes out of the study is the fact that there's a wide disparity in terms of the funding and the service levels of the different districts. And when you look at the ISO ratings, I think that if the ISO people got a hold of this report, I suspect several ISO ratings would be significantly impaired and they would go up, which is basically a bad thing. And so my encouragement is that this body consider embarking upon a study as to how do we fix this thing and make it better. I can tell you that from personal experience, I did get a cancellation of my homeowner's insurance after 30 years. The alternative the AAA will offer is the FAIR Act. FAIR would be an oxymoron because if effectively it is very, very expensive. And also we have a circular thing going on that if we can't get property insurance, we're going to have reduced property taxes because the value of homes are going to go down. So thank you very much for hearing me out.
Thank you, Mr. Snodgrass. I'm going to go to the title Monterey Regional next. Monterey Regional, we're going to give you the ability to unmute yourself if you'd identify yourself and share a 2-minute public comment with this board.
Can you hear me now?
Yes, we can.
You can. Okay. I'm not sure about how this works. Warren Poitras, also known as Pete, Monterey County Regional Fire District. Clearly, a wide disparity exists within certain areas of the county, with some of the most affluent areas enjoying extremely rapid responses with an abundance of personnel and equipment available, while others are forced to make do with a minimum of both. It is hoped that the Board of Supervisors will seriously consider the study's findings and address these issues on a county-wide basis. The northern areas that can afford to have paramedics assigned to their fire trucks represents quite an advantage. In the case of the Monterey County Regional Fire District, our citizens are indeed fortunate to have paramedics assigned to our Lara Fire Station. But the balance of the southern Monterey County paramedics are not readily available. As a LAFCO commissioner elected to represent special districts, these issues are of considerable concern for many of these districts. Given the recent wildfires experienced in Monterey County and all over the state, something must be done to mitigate the disparities pointed out in the study. Fire insurance is but one aspect of this ongoing dilemma. A resolution to these disparities can only be accomplished through guidance and coordination at the county level. And hopefully, eventually, something can be done at the state level as well. I want to extend my congratulations to Executive Director Kate McKenna and her dedicated staff, as well as consultant Michael P. McMurray, for all of their help and hard work in providing this study. Let's hope it does some good. Thank you very much for your time.
Thank you, Mr. Poitras. I see no other hands up, and so with that, I'm going to bring it back to the board for additional comments. Supervisor Phillips.
Yeah, this isn't something that surprises us, but when you see it laid out like this, it's a concern. The revenue limitations to property tax, and like we've seen in my district, which in North County, we've been really impacted when the Moss Landing power plant started closing down, and that was our major tax revenue. And so, and I am concerned about the wide variations between the district financing and unequal protection and treatment within the county. And so I think we ought to look to study it more, to not just study it, but come up with some answers and solutions to how you develop a countywide funding strategy that helps support. As mentioned, they go back and forth, and was mentioned by someone, I forget who, that as we annex into the city, that they're still using our highways to get to the cities that we got to take care of. And most of our calls out here aren't fire so much as they are accident, traffic, and other things we have to look at. But just looking at the study that was done and looking at say North County and Salinas Monterey Regional, we both have the same number, about same number of cars, 3,500 and 3,400. Populations, we have 42,000, they have 38,000. Their revenue is 17,000 or 17 million. Ours is 6 million. Their fund balance is 5.7 million. Ours is 1.1 million. And they have a lot bigger, and they have 7 stations, and they have a lot bigger area to cover. But it does show you that there's some real discrepancies. And North County, we've tried to have 2 ballot measures that have failed, but it's a critical issue for us. And so I would welcome us looking at it further to try to come up with a solution. But thank you, Kate and Sarah, for the good study, and it's something that we probably should have focused on before. So thank you.
Thank you, Supervisor. We're going to go to Supervisor Mary Adams next.
Thank you. Thank you so much, Kate. I really appreciate the report. I know this started with a referral that my office and I put together looking at fire preparedness and the defensible space, and you've turned it into a really magnificent, comprehensive report. So I thank you both very much for all of the work that you've done on pulling this together. My hope is that we don't just put this on a shelf, but that we really use it as some future planning. I mean, this is like a 3 to 5 year plan, if you want to look at it, by going through all of the various options that you've presented. I think if we had the bandwidth and the staff support, I would really enjoy working with my colleagues, and particularly in districts 2 and 3, to move forward with the suggestion on working for a countywide funding strategy for the fire and emergency services. I know that it's a heavy lift, but it's a much needed effort. And as I said, I think this would be a 3 to 5 year plan as that we would need to be looking at. What I also looked at is in the options, just the 2, and there are several different ones that I think we really need to focus on. And to my own residents in the Big Sur area, I really want to just push forward the thought that we really need to continue to work together on those two fire districts. I feel that we have to be able to come to some sort of an agreement, that maybe even a special study that would determine the best approach to funding and governance of those 2 areas, the Big Sur and the Mid-Coast area, so that we include exploring some kind of feasibility of forming a new fire protection district that would be, or using some existing fire protection district to serve the area. But there's a full range of costs and, all of the workers' comp and liability insurance and everything else that has to go into that. But I feel like it's something that could serve us very well. And I appreciate your calling that out specifically in the options. Additionally, within the communications, the specific matters that you brought forward, I think there are a number of things there that we have to take a look at. I personally was just kind of interested in the differences between our 211 system and CAL FIRE's dispatch systems. And what do we need to do to ensure that we connect those? And then I wonder about the sheriff's system. My expectation is the sheriff probably is on 911, but quite frankly, I'm unclear. And I know that we continually upgrade the equipment, but I have a feeling that their equipment is what is used to receive rather than to project. So believe me, I'm beyond my bandwidth here. So I appreciate your thoughts and consideration. As well, I think looking to the legislature and for some advocacy options, I think that's really going to be important, because I worry that we're not going to, at the county level, really have the bandwidth to be able to put some real focus in on this. And I, as I said at the very beginning, I don't want to see this sit on the shelf. So I'm hoping that our CAO might be able to work with staff to move forward and take up action on some of these recommendations, so that we are able to convene discussions that are needed to move forward on next steps. And with that, once again, I just appreciate so much everything that you put into this. I think it's exactly what we need at this point. and appreciate very much your willingness to work on this and provide the leadership and guidance that you do so well. So thank you.
Thank you. We're going to go to Supervisor Parker next.
Thank you, Mr. Chair. Yeah, I think I agree with my colleagues that really sitting down and developing some options and strategies to improve the equity or the more equal distribution of revenue to the different service providers, but also really looking at the bigger picture of funding options. And I think maybe it's the legislative committee, or maybe it's an ad hoc committee to sit down, not just with our county staff, but combine with the Special Districts Association, CSAC, any of the other, the fire chiefs. I mean, there are organizations who can help think these things through. We're not the only county that has these issues. So I think really using some of these statewide organizations to augment our thought processes, to look at, well, what can we implement locally, and where do we need to do advocacy at the state level for something, thoughtful and across the board that might be able to address the situation. I also think that in these options for consideration, there are a number of things that are, I guess before I get to that, I would say this concept, and this is something that the group, if we put something together, could look at. I think the PILT payments could be a possible, it's not going to solve the problem, but it could be part of the mix to make sure that we're getting revenues to help support the fire protection services. Then there are a number of things under the communications that I think it sounded as though there are discussions and things underway. It might be really good for us to get a report on kind of where we are with the emergency communications department and CAL FIRE related to CAD systems. And I know CAD always comes up when we talk about the ambulances. There are probably, maybe it's not just making sure that we have this capability with the fire folks, but making sure, all of the people we need to be communicating with, we have this capability, including fire folks. And then the radio infrastructure issue, we know that there are some issues about radio and being able to communicate in Monterey County. The interoperability of radio with fire and ambulances. I mean, these are all kind of in that mix. And then really to sit down and talk about what might be the ways that the RGIS could be made available or useful in certain aspects to the fire agencies. So anyway, I just think there's some really important things here, and I do think that if my colleagues are really interested in this whole revenue issue for fire protection, we really need to put some time and energy into thinking these things through and getting others to help us make sure that we're being, we're really looking at all different kinds of options, looking at the consequences of different options, and seeing if we can make something happen. Thanks.
Thank you, Supervisor. Supervisor Phillips, I see your hand up.
Yeah, I agree. But we got a top flight administrator there. I think we have him put together some kind of ad hoc committee. But it has to be the county and working with the districts. And I think what Supervisor has said, what Supervisor Parker has said, that we can reach out to CSAC and the other ones to get some ideas of how we move forward. But I think that's an excellent idea. I agree with my colleagues that we shouldn't just let this languish. We ought to move forward. It may take us some time to look into everything, come back with a recommendation or a plan for us.
Thank you, Supervisor. I'm not going to reiterate what a lot of my fellow board members said. I believe that they've touched a lot of the critical points, and at risk of sounding like Supervisor Phillips, back when I was growing up down in King City, it was, an all-volunteer force, and it was the place to be. It was that civic engagement, which unfortunately I fear every day we lose just a little bit more. And we had one of the best fire ratings in all of California, and I knew that because every year they'd tout it. They'd throw a big barbecue fundraiser, and they'd put the number up, what our rating was, and how we were up there amongst the best. But the challenge is, they're still there, and they're incredible. But the challenges that we face throughout California are growing. The fire seasons are being extended, and the challenges that we see as communities in terms of making sure that we can keep structures safe and keep families safe is real. I mean, we all face it every single day here in Monterey County. As we know, typically by now it's October, and I can say even 10 years ago, by the first week of October, the first rain would have been here, guaranteed. We would have had at least moisture in the air. We'd be watching the World Series, but thanks to the pandemic, that's all been pushed back as well. But that is all to say that this is a shifting target for us as a community, and these conversations have started at CSAC. When I first joined the Board of Supervisors, it was the hot topic. We were talking about what had happened up in Napa and Sonoma 2 years ago, and obviously then Butte last year, and these are challenges that now we're seeing here at home, and we've seen them before. I mean, I was here for so many fires, including Chimney, Coleman, Soberanas, Basin Complex. They're part of the reality of living in a beautiful place like we do with so much open space. It's going to happen, but how do we respond as a community to keep each other safe? And I agree that this is a conversation that needs to continue to help find ways to build up the resources that are adequate for us. But I think the bigger challenge, and it's a challenge that I'll lay out to all the other supervisors that I'm lucky enough to serve with on boards like the Latino Caucus and RCRC, is that we have to continue to put pressure on the state to also help. Because the funding streams that we have here locally, yes, they're important. Yes, we'll find a way. But it's going to take all hands on deck, because while we might have these ideas of what we should be investing in as a community, fire protection is one of those. And right now, we just don't hear it often enough in those conversations due to the fact that we are rural. We are a county that has a ton of open space. And yes, our voice isn't as big in a lot of those rooms where you get, the voting blocks of Northern California and Southern California put together, and we fall by the wayside, and we see proposals like the parcel fee that came on years ago. And again, I'm sounding like Phillips up here just talking about in the past. But for me, looking at all these pieces, I think we need to continue the conversation. I think we need to look at what we can do here locally while continuing to put pressure at the state level to join us in these efforts, because often we are the first line of defense, and often we are the first ones on scene. And love CAL FIRE. I'm not saying anything bad about CAL FIRE, and I believe the state has to keep up there and through CAL FIRE as well. I'm just saying that there's so much in partnership now that we're finding in all forms of government that needs to be done. Nobody can do this alone. It takes local, it takes state, and finding those places to cross in partnership, make sure we're on the same radios, make sure that we're working with one another to make sure that everything we do is coordinated in a way that saves dollars, saves lives, and saves property, and saves the environment. It's critical. And so I, too, support the concept of moving forward in some sort of a continued working group style, but I want to turn to Mr. McKee, having heard a lot of input on perhaps a role that he could play here, and see what his thoughts are.
Thank you, Mr. Chair. I think that the challenge here for us There are obviously many, not the least of which is the proliferation of districts and jurisdictions that are involved. And I think one of the keys for us as staff is to try to get from you as board members, what is the goal we're trying to accomplish? If the goal is an equitable distribution of resources so that everybody is on a decent playing field in fire protection, that's something I think that we could focus on. If the goal is something more as far as a larger conglomeration of fire resources into one, that's obviously a bigger lift, and so there are different challenges we would look at. I think if we could get some direction from the board as far as the goals, we could try to focus some resources to bear on it, whether it's bringing together the different, the 911 users group, the MCC, the Office of Emergency Services, and then all the local fire districts and the expertise that they have, trying to bring them together in a way that's not fragmented and not, we have some unity and purpose, I think would be most helpful. So what we could do is either if a board member has a nice way of framing a motion, that would be great. Otherwise, I could take a direction from the board to come back with some proposals on how to try and address some of the issues that were raised here.
Well, Mr. Chair, if I might, I think it sounds like most of the most urgent and comprehensive issue is the issue of funding, sustainable, adequate funding for fire protection. Out of that discussion is probably going to come, maybe governance options, advocacy at the state level. I don't think that I'm not in a position to tell you what the goals are other than that it's a little bit broad, the funding piece. But I think that by exploring that with CSDA, CSAC, and our local people, there will be a set of ideas and options that will start to bring forward where the actions can be taken, what the different options are, and other considerations. The consultant who has helped LAFCO with this study is a subject matter expert who might be helpful as well to try to rope into the process. But I don't know, do my colleagues have something more helpful to our CAO than what I've provided?
Supervisor Phillips?
Well, yeah, no, I think we have to kind of look at everything, and we have these, one of a better word, we got these fragmented departments. We got North County, and you got Monterey Regional, but we're all kind of connected. People got to drive through my jurisdiction to get to the peninsula, to get to Marina. We started looking at things, and we were exploring one thing of us coming up with a JPA with the city of Marina and North County because we're close and connected. But I think we have to look at, kind of analyze it and look at all aspects of it. But the big push, obviously, is what are we doing about making sure that they're adequately funding? And I agree with you. Some of the push should come towards the state too to provide some of that. But maybe we ask CAO to look at them, come back with a bit of a proposal where he thinks the direction of the task force or whatever we call it is.
So I'm wondering if, as an action today, just to throw out a proposal here, maybe we create an ad hoc committee of the board to work with Charles to look at some of these issues. I think I think there's still some vetting that needs to happen. I think several of us know who those players are that need to be at the table and involved in the conversations, and they are sensitive topics. Let's not dance around that fact. We have districts who are proud of what they're doing. And so any conversation about funding, any conversation is going to lead to about, structures is going to lead to some difficult conversations amongst agencies that have history. So let's create a forum for that. That would be my proposal that I would throw out there, and see what my colleagues think.
That's exactly where I was going to go, Chris. I feel like what we really need to do is take the LAFCO presentation, particularly the last slide, and look at those options, pull together an ad hoc committee from among the board and other community-based organizations, and obviously county and based organizations that need to be a part of it, and then really start to have the discussions that are going to be needed. As I said, this is going to be a 3 to 5 year project. This isn't going to happen overnight, but if we don't start working on it, we're never going to get there. I also think, looking at what we experienced last year with the whole brouhaha over the fire districts and the contract we were trying to pull together for EMS, it just shows that we've got to have outcome-measured, outcome-based approach to what it is that we're looking at within the whole fire issue just completely. So yeah, I really support your idea of pulling together an ad hoc committee. And as you said, we're going to have some difficult conversations, and I know my district is one of the ones that will, have a lot to say. So I would volunteer to be part of that ad hoc so that we can, move forward in a way that will hear lots of the voices that are going to need to be heard.
Supervisor Phillips?
Well, I think the ad hoc ought to be one of us, or some, but those of us who have the biggest stake in the game are you, Supervisor Adams, myself. So I mean, ought to be. I think ought to be 2 of us on there, but that's your decision. So.
I'm not going to fight you for one of those slots.
But is that agreement then, Supervisor Parker, that an ad hoc is the way to go? Okay, then Supervisor.
It sounds
Phillips,
like a short timer.
Yeah.
Supervisor Phillips, I'm happy to step aside on this one just because I do have quite a bit on my plate this year. Of course, as we go year by year, if that needs to change, I'm happy to help. But if you don't mind, I'd love to nominate you and Supervisor Adams to serve that committee.
I will serve if you don't let her pick on me.
Agreed.
Good luck on that.
All right, and I just want to turn to council and confirm that ad hoc is the correct structure for this sort of a committee.
That is correct. Ad hoc committee of 2 supervisors only, no other members. So you can meet with other people in groups, but membership is 2 supervisors only.
Okay, so I believe we've given direction. Mr. McKee, thoughts?
Yeah, I think that obviously at some point we'll have to figure out how to bring in all the various stakeholders that we've been talking about here. That's obviously really important. And then the knowledge base that some of them have is going to be key to trying to come up with a good plan for the county overall.
Okay, with that, I believe we've given input. Thank you so much to the staff from LAFCO and Mr. McMurray for putting together this presentation. It was thorough, well thought through, and critical in terms of the timing. So thank you for all the work you do in helping bring this forward for our board to make some considerations and have some tough conversations moving forward. But thank you for helping get this ball rolling. We greatly appreciate it. With that, we have concluded our business for the day. I'll start by.
I think you need a motion and a vote to create the committee.
The ad hoc?
Yeah.
Okay, my apologies. So we do need a motion and a vote to create the ad hoc, so I'll go ahead and make the motion on that. Is there a second?
Second.
Okay. And since it's an action, do I need to open up public comment on that action?
I think you opened up public comment. You don't need to on the motion.
Okay, perfect. With that, we'll go ahead and take a roll call vote.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye, the motion carries. Thank you so much. With that, we have concluded today's business, but I want to see if we have anything to read out from closed session, County Council.
Yes,
And we
thank you,
have an
Honorable Chair.
adjournment in memory too.
Yes, thank you, Honorable Chair, members of the board. I'm pleased to announce that by a vote of 4-0 with one Supervisor Alejo absent, the board approved the Unit H side letter regarding nurse practitioner salaries. That concludes my report.
Thank you, Mr. Gerard. And at this point, we will adjourn in memory of a couple different folks. I'm going to start with Supervisor Phillips, who will share with us some words about the Honorable Robert Marble Heinrichs.
Yeah, Bob Heinrichs was passed away at age 87. He lost a long battle with Parkinson's disease. He was preceded in death by his parents and his wife, Helga. He was born in Baltimore and was raised in an Army family and bounced around, but he was part of the, on his mother's side, part of the Marble family that was one of the pioneer families in the county. That's where he and his brother both had ranches up in the pastures of heaven, up in above San Bernardino and Corral. He graduated, interesting family, graduated from the United States Military Academy at West Point in 1955, following his father, class of 1928, his grandfather of 1902, and his great-grandfather of 1874. His father was a three-star general, observed the country until 1967. During his Army career, he served with distinction in various assignments. He went back to law school at Stanford and graduated in 1965, served a couple years in the Army, and then joined Abramson Search and Stave, a big-time law firm here in Salinas that was involved in most of the growers, shippers, and other issues during the labor strikes. He was appointed to the bench about 10 months after I did, 1984, and he fulfilled that thing for 20 years. He was known by everybody as the gentleman judge, unlike the rest of us where we kind of ran our courtrooms like street fighters. He was always the gentleman, the quiet, never lost his cool, no matter how obnoxious the attorneys were. Just a hardworking, good man. And he served on the bench for about 20 years. So he's survived by his two sons and daughter-in-laws. He will be buried at West Point along with his rest of his family. So thank you, Mr. Chair. Appreciate the opportunity to say goodbye to a former colleague.
Thank you, Supervisor Phillips. And next, we're going to turn to Supervisor Parker, who's going to share some words with us about James Martin Borkowski.
Thank you, Mr. Chair. Yes, I'm sad to say that Jim Borkowski died Friday morning, October 9th. He died of multiple myeloma, which is a cancer of blood and bone, for which there's no cure. He was married to Gail Borkowski, who served as our clerk of the board for a number of years, and she retired early to maximize their time together, you know, not knowing how much time he had. So he was born March 8th, 1953, James Martin Borkowski in West Haven, Connecticut. He had lived in Santa Cruz since 1978, 40 years or more. He worked for the Santa Cruz City Schools for about 30 or so of those years. He showed his intelligence and good taste and his sensible nature by marrying Gail. They have two children, daughter Jaslyn and son Tyrus. And one of the things that I really appreciated about Jim was the obvious delight that he got in other people's delight. He was just one of his wife Gail's biggest fans in her theater endeavors, where she has a good deal of talent, and also just supported her in pursuing some of her musical and radio interests. And it's just with a heavy heart that we send her our condolences on his really untimely death. Thank you.
CEO McKee.
Yes, thank you, Mr. Chair. Obviously, that's a sad time for any time when someone passes away, especially someone who is part of the county family here. Yeah, Gail was obviously integral to the county of Monterey for a number of years, and we feel for her and her family. And as Supervisor Parker said well here, that Gail and Jim were quite a team, and it was it was always good to hear about how they were looking out for each other and taking care of each other, and just had just a great bond. So we are saddened, obviously, to lose somebody that is close to somebody that we love here and worked closely with. So our hearts go out to them.
And I just want to, say that for so many years I got to work closely with Gail. When you work with the Board of Supervisors, the clerk is the linchpin that kind of makes these meetings come together. And Gail played that role for us for so many years. We nerded out together as technology caught up to what we always wanted it to be. We were, trying to get Granicus and Legistar and all these things set up. And when I met Jim, I saw it. I saw that dynamic duo that folks talk about. They just fed off each other's energy. And I remember learning about Gail's proclivity for really getting into theater and being, and I didn't quite see it. And then I saw her interact with him because she was so quiet here at work, and I saw it. And I knew that they brought out the best in each other. And today my heart breaks for her and her family for their loss, but I'm also glad remembering the day that she called to let me know she was retiring, because it was to spend more time with him, knowing that he was ill, and she got that opportunity to spend time with him and make those moments count. And like we talk about so often, those final opportunities to really show our loved ones what they mean to us are everything. And so I want to go ahead and say to Gail that our hearts go out to you. We still love you. We're here no matter what you need, and we share in your loss. And so today we adjourn in the memory of Jim Borkowski, and with that, our session has ended. Thank you.